test session, so take your seats, please. So we'll reopen the hearing at 10:01, since we lost, we had technical difficulties there. All right. Go ahead.
Ma'am, staff is requesting a continuance till November 9th. There were some changes that we need to incorporate.
Okay. So then, do we need a motion on that, or just take that under advisement?
Motion.
Okay, so
Motion.
can I get a motion then to continue this to November the 9th, please? At 9 a.m.
So moved, Madam Chair.
Okay, so we have a second? Oh. No, we had not called it. So public comment for item number 1, the public hearing. It will be continued to November the 9th, but are there any questions or concerns from the public?
If you'd like to make a comment in chambers, please provide a speaker card. On Zoom, press *9 on your phone or the raise your hand icon on your screen. No comments.
Okay, so no comment. So I had a first from Supervisor Hernandez. Do I have a second?
Second.
A first and a second. All in favor to continue this to November the 9th?
Aye.
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 Okay, 4-0. All right. So then item number 2, Joe Paul Gonzalez, our county auditor, clerk, recorder, registrar. Good morning.
Mike.
Okay, we'll open the hearing at 10:03 for item number 2.
Good morning, Madam Chair, members of the Board of Supervisors, and members of the public. Today is the second public hearing regarding the redistricting of the decennial census, redistricting of the supervisorial districts. And today we have the county's demographer, a replacement for our regular demographer. We actually have his superior, Dr. Justin Levitt, from National Demographics Corporation. He's gladly stepped in because our demographer actually had a personal crisis occur in his family. And so, thank goodness, we chose a corporation that actually has a very, it's not a one-man show. There's depth and breadth to that corporation. And without further ado, I'd like to present Dr. Levitt.
Thank you. Is it on the computer? Okay. Well, good morning, Chair Gonzalez, members of the board, members of the community who are here and watching on Zoom as well. My name is Dr. Justin Levitt with National Demographics. Dr. Tilton sends his regards. Unfortunately, he did have 2 family emergencies that happened right back to back in the last week. And so he and his wife have kind of taken a step back to deal with their personal tragedies. And so I'm happy to be here to fill in for him today, and I will do my best to present in his stead. So just to kind of give us a brief overview of where we are and where we are going, the redistricting process is required once every 10 years following the results of the decennial census. Normally, we would be getting underway much earlier in the year, but because of census data delays, the revised or adjusted census data that we are required to use as part of the districting process was not available until late September. In fact, it wasn't until September 21st that we got the first round of prisoner adjusted data, and we even received an update on that on September 27th. Now, following that data release, we've worked really quickly to kind of get the process moving along. We've had 4 public town halls in October, starting on October 6th and continuing all the way till last Friday on October 22nd. In addition, we've had one kind of staff-led public hearing, but this is going to be our first here at the Board of Supervisors. However, that's not the last. There's going to be an additional 2 public hearings in November, on November 9th and November 23rd, to continue to look at the draft maps and make adjustments as necessary, with the anticipation that we will adopt a map prior to the December deadline for adoption. And so part of the challenge of this process is that the rules and goals of redistricting, the criteria we use, have somewhat changed since we went through this 10 years ago. Federal law, that is what the courts require, has more or less stayed the same. So equal population, each district must be substantively have the same number of people. That's the one person, one vote standard. We have a maximum deviation or difference between the largest and smallest of 10%. And if we're above that 10% number, then we have to look at making adjustments to bring that number down under 10%. But we don't have to get to perfect equality like they do for congressional districts. We are allowed some leeway to better represent communities, as we'll talk about throughout the rest of the criteria. In addition, we have to look at the Federal Voting Rights Act. Race cannot be the only or even the predominant factor in the creation of a district. It must be one of many factors taken into account as we look toward communities of interest and other criteria. What has really changed for this round of redistricting is this middle column that we've labeled California criteria for counties. This comes from a new law passed last year called the Fair Maps Act. And what the Fair Maps Act now does is it takes all of these factors that we used to balance with each other, and we used to weigh them against each other, and now it rank orders them. It says this is the list of priority that we have to consider certain criteria. So first on this list is contiguity. Contiguity is the idea that a district must be one whole piece. You have to be able to walk or drive from one part of that district to every other part of the district without leaving the district. So you can't have a little bit at the far north end and a little bit at the south end of the county that are not touching or not attached to each other. Second, undivided neighborhoods and communities of interest. Now, the law talks about socioeconomic geographic areas that should be kept together for the purpose of their effective and fair representation. I'm going to talk more about what that means on the next couple of slides. But in general, if areas kind of share common history, common issues, common problems, then we have to look at keeping that neighborhood together if possible. Third is cities and census designated places, or CDPs. The law specifically calls out these census designated places as well as your incorporated cities as communities of interest that need to be kept together. Underneath the general communities of interest, recognizing that a city may have 2 very distinct neighborhoods or 2 very distinct parts, but it does want us to try to aim to keep communities like your cities and your CDPs together. Fourth, easily identifiable boundaries is the principle that it should be easy for voters to understand which district they live in. So the extent that we can follow natural and man-made features like roads, canyons, and in rural areas, making sure maybe that all the properties along the same road are in one district to make it easy for people to understand which district they live in. And fifth, they define compactness, not bypassing one group of people to get a more distant group of people. And this is really where this rank order can play out. If we have a community of interest that makes sense, but it follows a line that's less compact, we have to keep the community of interest together first, and then think about compactness later. That's a trade-off that we have to make. If we need to balance population, we may have to divide a community. If it works out that that community is too large to be kept together. So this is where the rank order really comes into play, and we have to consider these factors in this order. Now, the Fair Maps Act also contains a prohibition on favoring or discriminating against a political party. So obviously local elections are nonpartisan in California. Our data set does not include partisanship information, and that can't be part of your considerations as we're looking at the different options. Now there's also this third column, other traditional districting principles. Once we've looked at the state and federal criteria in that rank ordered fashion, We can also consider additional principles that have been recognized by the courts. And so the courts over the years have recognized factors like preserving the core of existing districts or minimizing the voter shifted between election years. Both are going to the same idea, that if a voter last elected or last had a vote for a member of the Board of Supervisors in 2018, and they're expecting to have one in 2022, delaying that to 2024 might mean going 6 years between participating in an election. While another voter switching from a 2024 seat to a 2022 seat may only have 2 years between getting a chance to voice their opinion for the board. This also goes toward respecting the voters' choices or continuity in office, the principle that the voters of the district of the county have elected a board, and that it should be up to the voters to make decisions about whether or not to keep members of the board, not the stroke of a pen on the map. And also, we also do mention future population growth. I warn you not to go too far down this rabbit hole, because it's sort of like if you know that there's a massive new project that's going to double the size of a particular neighborhood or community is in the works. We know it's going to happen in the next 10 years. That's one potential reason for a little bit of inequality, population inequality. We can underpopulate that region that's going to grow. But simply talking about a specific project that's not going to affect the overall numbers that much, that's not really what future population growth is about. It's aimed at cities that are growing like 100, 200% over the course of a year or a decade. Looking at the current districts, right now the current district boundaries have a 17.17% or 0.11% deviation. That's above that 10% maximum. So that does mean that the district boundaries will need to change. And if we look at this at a district by district level, we see that District 1 is overpopulated by 10.6%, while Districts 2 and 4 are each underpopulated by approximately 6%. So this is where that number comes from. We're adding that largest and smallest number together to get that 17% difference.
Excuse me, Doctor, if I could ask a quick question on that one subject. I understand the balance of population, but it's interesting in looking, and I know you'll be getting to it, but when you look at voting age population, it suddenly shifts pretty significantly. But I gather that just outright population is what you have to look at, not voting age population. Is that correct?
That's correct. California law specifically says to use that total population count, and that's following the Supreme Court's guidance over the years on that topic. So it is that census number that counts everyone. Now, as the board members noted, citizen voting age, or the eligible voter population, can vary wildly from district to district as well. Even districts with very similar total populations can have very different citizen voting age or eligible voter populations. And so right now the county has two majority Latino districts, Districts 3 and 5, as well as 2 that are equal or close to being equal between whites and Latinos in Districts 1 and 2. So, this matches the overall county's demographics, about 50% white, 50% Latino, with a small Asian and Black population. This also gives us our ideal population for each district. So after the adjustments, that target number is 12,876. And I'll just take a second to mention this doesn't mean that any of the council areas shrunk or board areas shrunk in the last decade. It's just that growth disproportionately happened in certain Board of Supervisors districts. So to talk a little bit more about neighborhoods, when we talk about that criteria of neighborhoods and communities of interest, what we're talking about are 2 related but very closely related topics, but slightly different. Neighborhoods are smaller. We think of them as the building blocks that go into the districts. And so these could be individual subdivisions. They could be connected. I know it's a separate criteria, but they're very much connected, especially to smaller CDPs, smaller cities, and smaller communities throughout the county, even that don't have a CDP name. but are kind of well known as having a central point where they're focused on. Neighborhoods could also be areas along a particular street or rural road. They could also be areas that share something similar, such as maybe farms that grow the same kind of crops, or similar water issues, similar fire issues. However they relate to county government. And that's really the focus point of communities of interest as well. How do they relate to this particular level of governance? Because the school board, the cities, the state, they'll all be looking at different factors that are relevant at that layer of government. And so when we think about communities of interest for the county, we're thinking about those county services and the way that those county services are used in different parts of the county. And so what are the shared issues, the shared characteristics, the shared concerns, the shared, I say socioeconomics, but the numbers help tell the story, but the numbers aren't the story in and of themselves. Just because an area shares some sort of demographic similarity doesn't automatically make it a community. And this is where we need to hear from members of the community and members of the board about what these communities of interest are for San Benito County. Because I'll tell you, everywhere we go, we hear about different issues, depending on the size of the jurisdiction, depending on the rural or urban nature of the jurisdiction, and just depending on local factors. That's what we want to hear as we look at how we can make adjustments to the current map, to redraw the map, to make it work for the next 10 years. And as the law specifically says, what communities benefit from being included within a single district for the purpose of their effective and fair representation? How can we draw communities in such a way that empowers different, the different communities, the different neighborhoods throughout the county over the next decade? And just as a kind of very reminder, we're not talking about the politics, or at least not the partisanship here. These are issues, concerns that are nonpartisan or bipartisan, not ones that really are specific to helping a specific political party win. So looking at some of the tools that we have available for this process, we want to emphasize that we want to hear feedback however people want to give it. Whether people want to just submit a comment in writing, or phone in, or talk today, give it verbally. But if people do want to draw their own maps or review the maps as they come in, we have tools for that as well. We're going to have a simple map review tool. We call this the interactive web viewer, because it lets people use this like Google Maps to search for addresses, to turn on and off different map options, and really explore the details of each draft map or each plan as it's presented. This is really a great way to just learn about the community and learn about the way that, or compare different draft maps as they come in. For people who want to take a stab at drawing their own tool, but maybe are just kind of wanting to do something at the kind of straightforward, basic level, we have paper drawing tools. These are available as PDFs on the county's website. And these are great if you don't have internet access, because they can be printed out and shared with the community. What they have are total populations of each of the different regions. So you can just get out your phone with the calculator app, or do it by hand as you add up the different areas, or just color in your neighborhood or community. We also have a version of this that uses Excel. So when I say uses Excel, what I mean is it does the math for you. So if you're worried about crossing your ones, or getting your math right, and if you have access to Excel, then you can download an Excel spreadsheet with the demographic data from the different population units, and it will automatically calculate this all for you. We also have available some more advanced web tools for those of you who have browser access and want to play around with this in detail. District R is our community drawing tool. What it does is it lets you really paint different neighborhoods or communities throughout the county. One of the things I really like about District R is if you're in the community of interest drawing side of the program, you can draw overlapping communities. So you can say, like, I think this is a community, maybe a larger area, but also if I had to subdivide it, this is these kind of smaller communities that make up that larger area. You don't have to pick which community each block is a member of. You can assign it to multiple blocks. I really like that feature on District R because it really helps us understand where the clear borders, the clear differences between communities of interest are, as well as where communities of interest get fuzzy. Because the boundaries between communities of interest may be a little bit unclear. And then for those of you who want the most, advanced tool, or most, I guess, complex tool, Maptitude Online Redistricting is a version of the same program that we use as your demographer to draw your district boundaries. So what it does is it lets you go in and draw a plan block by block. You can start with the current districts or start with a blank map and make adjustments until you balance the populations. Now this one makes you force a choice. You have to choose to assign it in one of 5 districts. But if you really want to get into the weeds on the data, as well as see just where the census blocks are and how many people are in each one, Maptitude Online Redistricting is the way to do that. And people who discover this program often can't stop at one. If you take the time to learn it, we often get 2 or 3 maps at least from the same person because they just have a lot of fun playing with the map after you learn how to do it. It has a bit of a learning curve. I have to warn people that even with the help, we do have a lot of help guides for this because we know it's complex, but it does have a bit of a learning curve even with that. And so just to kind of reiterate this final point, we really do hope to hear from you however you want to provide information. So we welcome everything from a simple comment or in writing all the way up to a full map submission. And so I look forward to our conversation today. This is a pre-map hearing, so we haven't drawn any prospective maps yet. Our goal will be to show those at the next board meeting in November. So we're looking for the feedback and testimony today that we can take back with us and put into drawing those draft maps. And when I say today, I do mean today, because we actually do have a deadline today of 5 p.m., I believe, for any submissions that will be used in the preparation for the first round of draft maps in November. And I'll emphasize that's the first round. So if you get something in after today or you want to go back and play with it a bit more, you will have another chance to submit prior to November 23rd. But for us to consider it the first meeting in November, we're going to need it today in order to get it processed, drawn in, and ready to go for that meeting. This is mostly driven by deadlines that we need to have things posted so far in advance of that meeting so that the community has time to review the maps before that board meeting. So I'm happy to answer questions about the districts, about the process, or about any of the data I showed today. Otherwise, I look forward to our conversation. Thank you very much for your time.
Thank you.
My understanding is currently we have 13 maps that have been submitted from the public, and those will be reviewed at the next meeting. If there's
Yes,
no other
go ahead.
questions,
Madam Chair, a quick question. Joe Paul, at this point in the process, what is the role, just for clarification, of those of us here as supervisor? Do you want to get input from us at this early stage, or are we still at this point just kind of sitting back, getting public input and obviously eventually weighing in? But I'm just curious where we come in. Thank you.
Thank you for that question. We would welcome feedback today from both the community and the board on the direction to draw the draft maps. So I would say in terms of neighborhoods or communities or principles that you would like us to consider, it would be fine to talk about that today. And then we come back doing our best job, trying to incorporate that into additional maps that add to the conversation. And then you can review those at the next meeting, but we certainly welcome direction today.
I have a different question that just occurred to me. How do you, when you're looking at this, in our community, we're dominated by, one city, Hollister, and then there's unincorporated areas of the county. Although many of us live outside of the city, our address is actually in the, the same address. But my question is, do you, in your process, do you try to get everyone that's actually in the city limits of Hollister within a certain district, as opposed to then having some of that bleed over into unincorporated areas of the county? How do you play that into it in a situation like ours?
Yeah, I think that it's very true that, we have to look at, we have to look at the current cities, but that criteria comes after communities of interest. So if we think about communities of interest first as being more than just the city itself, but including that unincorporated area, and we can talk about how, or if the city is large enough that it has to be divided anyway, or it has to be divided for Voting Rights Act reasons or for other reasons. Like, there's many reasons why we might divide a big city, especially one like Hollister that dominates the county. And just to give another example, you could draw 2 entire Board of Supervisors districts in the city of San Diego proper, but the county always ends up drawing at least 3 into the city because of voting rights and other neighborhood communities of interest concerns. So that would be something that we could definitely look at as part of understanding the different communities in the city.
I had a question, Madam Chair.
Go ahead, Supervisor Hernandez.
Yes, thank you. So I know that the drawing of the maps are based off of the lines, basically the census numbers. But obviously there's things that are changing constantly, and development is one of them. So, you could technically have a certain district drawn up where it might even seem pretty even with the rest of the districts population-wise, but then all of a sudden you have a development where houses are being built and people are moving in between December and then even the next election cycle. What do you, is there a way to address that? Because ultimately you can end up having an extra, 300 to 3,000 voters. Just depends on the size. I just know that like the Santana Ranch project is a huge project. And, I imagine there's going to be a lot of people moving into those houses before the next election. And if they register, that changes the dynamics of the actual districts. So what can be done to at least, I know you can't change because the census maps is based off of the population when you got it, but, is there any way to address that?
Thank you for the question. You of course can slightly underpopulate a district if you know that there's going to be future growth or development there. And if you know that an area in particular is going to grow quite a bit because of a large project or development, then you might either consider underpopulating that area or dividing that area between 2 supervisorial districts so that that growth is shared over 2 communities, if that makes sense. But I would also caution, we've seen a lot of cities over the years or counties over the years that have said, we're going to grow massively in this area, and then they haven't accounted for smaller projects, infill growth, or other development elsewhere in the county. And so where they think they're going to get all their growth ends up being a sizable chunk of the growth, but maybe not quite as big as they expected. So we can certainly take that into consideration in terms of that population, but or through dividing it up. But you can't exceed that 10% deviation limit, and I'd also caution about being too eager to underpopulate just one area.
Any further questions?
Thank you. No, that was it. Thank you, Madam Chair.
Okay, thank you.
Yeah, and I don't have any real specifics, but the only comment I would make in looking at the existing districts, and I'm sure this, well aware of this, but some of the districts, obviously in order to equalize population 10 years ago, they're very difficult to follow in terms of, you'll have fingers that will come through, for example, you'll have a district from San Juan Bautista, Supervisor Kosmicki's that, comes into Hollister. You have, my district that may incorporate other, anyway, when you look at just from a geographical standpoint, it doesn't make sense.
Right.
But you're doing it from a population standpoint, I understand that. But, obviously, I would just encourage you as much as you can within the criteria you have to follow to try to get these districts more compact. I realize that's not the number one criteria, but it's just so much easier for citizens then to know what district they're part of. Frankly, there's parts of my district that I'm still a little unclear on, and I have to go back and look at the map, and you have to check and this and that. So anyway, that would just be my comment. Thank you.
We're taking notes to ensure that the comments of the board are incorporated in the map drawing.
Okay. So I have no further questions. Anybody else? No? Okay.
We're just open to the public.
Okay, so let's go to public comment, please.
If you'd like to make a comment in chambers, please provide a speaker card. On Zoom, you can press *9 on your phone or the raise your hand icon on your screen. No comments.
Okay, so I guess there's no further comments. Okay. Thank you, then. Okay. So in
Madam
terms of-
Chair?
Oh, yes, Supervisor Hernandez.
I was just going to make one final comment. I was kind of hesitating, but even just for the sake of thought, I know that right now, or prior to today, basically these lines were drawn based off of, which kind of piggybacking off what Supervisor Tiffany had mentioned, is to a certain extent you have districts kind of touching the city because of the fact that they needed to increase their population representation, so that way there's a little bit more of a, because I know it's the 10%, right? So you can't be too far out of 10%. So long and short is you have, like District 2 touching the city, you have District 4 touching the city, and so, and that seems fair. I would just caution that there's not too much change as far as that goes, because I know, like, as an example, and this is just my thoughts on the rural nature, it's very different. The rural needs are different than the city needs. And if that changes too drastically, then all of a sudden you have underrepresentation for the rural communities. So those are just food for thought, that's all. Thank you, Madam Chair.
Okay,
Thank you for that comment.
thank you. That's it? Okay.
Madam Chair, do we
Go
have to close the public hearing?
Yeah, we
Open-
want to close the public comment, and then just, I think you've already provided staff directions, so that's all we need.
Was that enough direction for you?
It sure was. Thank you very much.
All right, then we'll go ahead and close the public hearing then on this. 10:35. All right, thank you. So, back to the regular agenda, we're item number 3.
So we have Dr. Geller on the phone, as well as on Zoom, and as well as Tracy Belton, our Health and Human Services Director.
Okay.
Tracy?
Yes, good morning. Let me share my screen. Okay, Dr. Gellert is going to lead the presentation today. Dr. Gellert?
Good morning. We want to provide you an update on a variety of activities, including our vaccination program and incident rates in the county at present, recent days. Next slide, please. So we continue to see a gradual decline from our peak of Delta variant recently, moving in the right direction, perhaps not as quickly as we had hoped, but continuing sustained decline. We have 80 active cases presently in the community. Of our hospitalizations, as previously, the overwhelming majority are among, unfortunately, unvaccinated individuals. Deaths, we have a 74 total number of deaths thus far, again, largely within the unvaccinated community. Next slide, please. This provides a incidence rate by vaccine status, and the blue curve here are among individuals who have been vaccinated, the orange one, the unvaccinated. And this just reinforces the points in the prior slide that there's a big, very big, significant difference between those who are protected by the vaccine versus those who remain unvaccinated. Next slide, please. This is an overview of our current vaccination rates. We are really within a very close range of California statewide level of immunization. And that's a great accomplishment that I think Tracy and the team, working with our variety of partners in the community, the foundation, of course, we've really pulled that up over the last couple of months, slowly but surely. And it's worth noting that California is amongst the best performing states in the union. So, you know, we're doing as well almost as anyone in the nation, with the exception of a few jurisdictions that are up in the 80s already. We still have work to do, as you can see in the partially vaccinated. That is an emphasis within our outreach. We'll discuss that in a little bit, but we want to complete those vaccinations very much. Next slide, please. This breaks down the vaccination rates by race and ethnicity, and I'm really pleased to again communicate with the board that we have pretty much eliminated any concern about inequities. We are, of course, in a Latinx majority community, but we know that there are significant socioeconomic, health access, and other inequities and impediments to getting healthcare in general and in health status. So we are actually doing better within the Latinx community than in the white community. Clearly, we need to continue to improve in both, but a major concern about the unequal distribution of vaccination and the opportunity to get vaccinated, I think we've handled that very well. Next slide, please. This gives you a breakdown of vaccination by major age groups in the county. We still have work to do across all of them. I'd really like to see, obviously, the elderly community who tend to have multiple, what we call comorbidities or pre-existing chronic diseases, some of which are cardiovascular or lung-related, and make them at much greater risk, if infected, of a severe course of illness requiring hospitalization. So that is clearly an imperative for us, but we need to pull all of these up step by step over the coming weeks and months. Next slide, please. I'm going to turn over to my colleague to discuss the vaccine rollout that's being planned and implemented.
Mary, are you on? Pharmacist Mary White.
Yes, good morning, everyone. Thank you. All right, next slide, please. All right, so as most of you probably already know, there have been some recent FDA and CDC approvals regarding COVID-19 vaccination for boosters. And in addition, we soon expect approvals for the pediatric population, which would be the 5 to 11-year-olds. So starting with the booster approvals, just a quick summary. Back in September on the 24th, the CDC, the FDA, and the Western State Scientific Safety Review Work Group both recommended and approved Pfizer vaccines for boosters. And then just this past week on the 22nd, both Moderna and Johnson & Johnson were also approved to be able to be given as boosters. So regarding, who's eligible for booster vaccinations, in summary, for the language put forth by the CDC and California Department of Public Health, a Pfizer or Moderna booster dose is recommended if you've received your second dose at least 6 months ago. For people who are 65 and older or 18 and older who live in long-term care settings, 18 and older who have underlying medical conditions or at increased risk due to social inequities, or who work or live in high-risk settings. For Johnson & Johnson, booster doses are recommended if you've received your first dose at least 2 months ago and you are 18 and older. So bundled in with this approval was also approved the ability to mix and match booster doses. So this will give us much better flexibility. And really what this means is that you're no longer bound to have to receive the matching vaccine. So the booster does not have to match the same type of vaccine you received for your primary series. So for example, if you received a Johnson & Johnson, you can receive a booster with Johnson & Johnson again, or a Pfizer or Moderna, and vice versa, and all the ways to mix and match those. All right, next slide, please. This is just to remind and highlight that booster doses are available through all current channels, which include healthcare providers, clinics, neighborhood pharmacies, public health clinics as well. Anyone can visit the MyTurn website or call to make an appointment to find a nearby vaccine clinic that's convenient for you. And note, many of those places also welcome walk-ins. Next slide, please. So this is just a visual about the process timeline for vaccine approval by the state and federal government, kind of their rollout. So basically, Pfizer COVID vaccine is being reviewed for approval for its use in children 5 to 11 years of age. The advisory bodies to the FDA and the CDC are meeting respectively today and early next week. The VRBPAC is the advisory committee to the FDA, and the ACIP is the advisory committee to the CDC, and they both need to do separate reviews and input. If all goes well, we anticipate formal approval towards the beginning of November is what we're being told. All right, next slide, please. So this slide is actually a state slide, and it just reflects their process for the pediatric vaccine rollout, but I'm going to summarize. So to prepare for the approval of the pediatric vaccine and facilitate quick shipments, the California Department of Public Health, or CDPH, used a sort of pre-order allocation process just for this initial shipment only. CDPH allocated amounts to counties for pre-ordering, and they divided it into 3 waves. But note that all 3 waves of the pre-order vaccine will be shipped and received within the same first week of November, as long as the approvals by the FDA and CDC go as we anticipate. San Benito County was allocated a pre-order total amount of 1,200 doses, but keep in mind, this does not in any way impact our ability to order more vaccine. It was just a way for the state to begin those deliveries immediately upon approval. You know, they wanted to be able to be poised to start deliveries literally the day that they get approval. So that was just a quick way for them to be able to do that. So after this initial pre-order rollout period, vaccine providers will be able to immediately submit orders for additional vaccine supply as they normally do for all COVID vaccines at this time. So in other words, it was only for this initial pre-order week that allocations were made by CDPH. After that, it will be business as usual, and we and all providers can order whatever we need when we need it. CDPH has reassured us that there is plenty of pediatric Pfizer vaccine available. So I think that's it for me for the moment. Thank you.
Thank you, Mary. So just a brief update on our vaccine incentive programs. So you're all aware that we did have a first dose vaccine gift card incentive through our public health services, and we did exhaust that funding. However, we were able to request more funding from the immunization grants, and we were granted $60,000 to have a round 2 of this funding. And so we will be putting out a press release hopefully today. So with the dates of when we exhausted the funding, and then it will start over again for people who have got first doses, excuse me, from after the round 1 was exhausted. And so look for that. They will be offered at our public health services office on Tres Pinos Road. And then our second dose, fully vaccinated and cash incentive programs, We have $116,800 left of this voucher program. You can see the increase by 16.8 increase since the August 10th when the incentive program started. And so it's for the board's consideration to extend this program. This was authorized by the board, and we wanted to provide this data. We do anticipate that we forecast that the cash incentive funding will be exhausted on or about November 12th. We did a partnership with the Community Foundation. They have, there will be a $500 drawing that comes out of this month from October 1st through November 5th. And there will be one winner of $500 through the Community Foundation, and they will announce the winner. And then I just wanted to provide a quick COVID-19 testing update, just reminding the county individuals and anyone who may work here or live here that we still have the testing at the Hazel Hawkins Community Clinic, Sunday through Thursday from 7 a.m. to 7 p.m. Walk-ins are available, and you can also schedule an appointment through LHI on the website. And then outreach efforts, just wanted to provide a brief update. Dr. Gillett, were you going to lead this slide?
Sure. So we continue on an ongoing basis to increase our outreach and diversify the strategies we're utilizing to engage and educate members of our community about the state of the epidemic and the opportunity to protect themselves. A billboard has been finalized, and that'll be up November 1st, focused on the opportunity to be vaccinated and avoid disease. We are securing dates to actually film an educational video for the public, and obviously that'll be pushed out through our own website and through social media. We're collaborating with the San Benito County Office of Education to distribute an all-resident mailer. We hope that'll go out on November 1st or shortly thereafter. Again, educating parents in particular about the opportunity to get their children vaccinated and protected. Public health continues to work with various key local partners, including the media, obviously Hazel Hawkins Memorial Hospital, who has a new chief clinical officer. We're very much looking forward to working with her, as well as continuing to work with the leadership team there, the foundation, the Farm Bureau, and the Office of the Youth Alliance. So the messaging continues to focus on not just COVID-19 at this point, but also on the imperative to get protected against influenza. We were really protected last year from the usual influenza seasonal epidemic that occurs because of all of the protective and preventive measures, the masking, the distancing, avoiding social congregation. And there is some expectation in the epidemiological community that we may see a pretty robust vaccine season, flu and other respiratory pathogen season. We expect those to become present again. And we really don't have an understanding at present of what co-infection with influenza and the virus that causes COVID-19 might look like. And that's a real concern. If an individual has contracted the COVID virus, that's already compromising their ability to breathe if they become clinically severe. And then superimposing on that, or having COVID superimposed upon an existing infection with influenza, there's a lot of concern in the clinical and public health community that could be a very challenging clinical care picture. And so we really very much want to encourage, even particularly among those who, for whatever reason, have not yet been vaccinated against COVID-19, to please get their influenza shot this year. This is really not a year or a winter where you don't want to be protected against influenza if you're not also protected against COVID. Next slide, please. So we're going to provide an update on what we're seeing in the schools at present. Next slide, please. So this provides you a school summary with the graphic on the right is number of cases that have occurred across the different schools. We've had 75 cases reported by schools to public health since the beginning of the last week of September. These were mostly among students, but there were a handful of staff cases. Most of these were not related to an outbreak. And in terms of the timing among the 5 to 18, you can see that actually we didn't get a huge bump when school went into full force from the midsummer. Pretty similar incidence rate. Next slide, please. This provides you a picture of those cases by grade. And you can see it's really all over the map from the near middle schoolers in the 6th grade, kindergarten. Is a substantial distribution across the entire age strata. And that's probably to be expected. We didn't expect there to be any necessary clustering by level of grade, at least at this juncture. Obviously, we're going to continue monitoring this and sharing this information with the community at large and the board. Next slide, please.
That concludes our presentation. If there's no questions for us, or if we want to hold questions till the end, Assistant CAO Edgar Nolasco is going to present on the San Benito County testing mandate update.
Madam Chair, I had a question.
Yes, Supervisor Hernandez, go ahead.
Thank you. So, Ms. White had mentioned, and I was kind of confused because I was reading through the slides, and this is one of the presentations that we caught last second, and I saw there was added data that was different than what we initially got. But anyways, she said approval when everything on that language, and I mean looking on the CDC website, it says recommended. So I'm trying to make sure that we're not confusing the public. Are you saying approved to be distributed? Or are we saying legally approved and therefore no longer falls under, or basically is no longer considered experimental, therefore it's no longer under the emergency use authorization, the law?
Hi, yes, thank you. So for both the recent recommendations and decisions regarding booster doses and the coming pediatric, those are still under emergency use authorization as far as it impacts the way we are able to procure and administer those vaccines. The ordering process, approval of ordering process, is just in reference to the state system for us to put orders into the system to request vaccine to be delivered to us. But as far as the status of the vaccines themselves, the boosters and the coming pediatric doses will be under emergency use authorization.
If I could just add to that, Supervisor, just to mention, the emergency use authorization is about finalizing safety. It occurs after all of the safety validity and checks have been completed on a scientific basis. Once that's approved, as we expect now for the pediatric vaccines, it's not really experimental. Experimental suggests that we don't know the outcomes. There are risks that have not been identified. So none of the vaccines that are currently being administered to the public in the U.S. or anticipated for our children in the coming months are experimental once they've completed the combined FDA and CDC review process, which is an evidence-based scientific evaluation of the safety profiles and any risks of new vaccines.
I appreciate that, Doctor. And yeah, it was in a roundabout way, you're basically saying, from what I'm hearing, is hypothetically, once it goes through the process, then it will be no longer experimental. But as of late, it is still considered experimental, right? So we can hypothetical all day long. So I'm not disagreeing with you. I'm just saying this is really, really important for the public consumption, because they hear approved, they think that means it's no longer experimental, it's super safe, there's no problems with this. And if that was the case, and it's funny because I kind of brought this up earlier or a prior board meeting where we basically had an issue with basically support, when it comes down to these mandates, and I've argued this, and I know there's liability coming. But my point is there was a mandate that was supposedly going to be presupposed by the federal government under Joe Biden's presidency, where he was going to roll this out. And as of late, we still haven't heard any official declaration, not only of a mandate from the federal level, but ultimately where these vaccines are no longer considered experimental. So all of this is just basically hypothetical, and that's really important because the main element of the emergency use authorization that's really important is that people have choice, right? Because of that, because of the Nuremberg Code within the EUA, it basically guarantees you don't have to take this if you don't want to, and it's hard to force anybody to do it when considered experimental. But once it gets taken off, then I guess it would be a different situation. But that's not the case today. And I feel like every conversation we've had with the public has been assuming that this is not experimental, and that's just not true.
Supervisor, just to clarify, from a clinical, a public health, a safety point of view, the vaccines that are currently being delivered and have been delivered to the American population, that will be delivered to children in coming months, have passed through that safety review that has been completed, and they, at that point, are not considered experimental. No one uses the term in medicine or public health on these vaccines that they are experimental in nature. They're not experimental. They have proven efficacy and proven safety. The data is absolutely unequivocal, and the evidence is overwhelming that these are safe and effective. So again, from a clinical and public health point of view, these vaccines are not experimental.
Yes. Well, and I don't want to. I respect your opinion, doctor. I'm obviously not a doctor. But if that was 100% true, then these would no longer be under the EUA. That's my main point. If it was that clear, then they would no longer be EUA, but they are. So that changes the dynamic. Again, even for the sake of public transparency and for them to really understand what they're dealing with, that the EUA still stands for these vaccines.
And I believe the question has been asked and the question has been answered. Can we move on from that point, Supervisor Hernandez?
Definitely, Madam Chair. Yes, I'm not going to beat it up anymore. But so I had a question, Doctor. So we mentioned the death and basically the infection rate. I would like to know how many of these cases had underlying health conditions. I don't think we ever hear that, as it pertains to people being hospitalized or even the death count. And where are the major breakthrough cases? I know you highlighted there was only 2 that was vaccinated. But I think even just for clarity, that's important information to understand.
The breakthrough cases have been among individuals when it required hospitalization. You're absolutely correct in your intuition that these were individuals who had, in both cases, significant pre-existing morbidity or illness, what we refer to as these prior potentially complicating health conditions. So that is correct perception. Among the breakthrough cases generally, as I mentioned during the presentation, the large majority of these have involved a very what we call a self-limited illness, a mild cold-like illness, in which someone who's vaccinated, may have a little fever or feel under the weather and fatigued. It's transient, it passes, and they recover typically without needing to go to the hospital at all.
Thank you, Doctor.
Thank you.
Yeah, and those are my final questions, Madam Chair. Thank you.
To ask from Dr. Gallard and Tracy is that if your PowerPoint presentation can from now on be included in the agenda packet. I understand sometimes you have to have an updated number that comes in the day or so, and so you can always give us an update, but the shell that we received is it doesn't even look like the same PowerPoint that I received this morning at 8 a.m. And so on the line of transparency and deadlines for agenda, I'm going to ask that you really work to get the PowerPoint to us in a timely basis. Please.
Madam Chair?
Yes.
Can I make a couple comments, and I have a couple questions? First of all, as far as the timeliness, I understand your point, and ideally I agree with you. I know they're trying to get the data as recent as possible.
Right.
So obviously, it may not be possible to get it, the current information, a week in advance, obviously, but I understand your point. Just one comment, and then or a couple comments. First of all, I have to say that it's very frustrating to continue to hear talk about experimental or trying to talk up underlying conditions, all trying to undermine us, what we're really trying to do, which is keep public safe, get as many people vaccinated as possible. These are not experimental vaccines. Dr. Gellert, I think, made that extremely clear, and I think it's a disservice to our county to continue to try to put out misinformation about that kind of a thing, and it undermines what we're trying to do, keep the public safe. As far as underlying conditions, yes, there are underlying conditions, but for every person I've heard that had an underlying condition, I've also heard of people that were young, healthy, and had no underlying condition, and yet they're no longer living because they were not vaccinated. 70 out of 72 people that have died in our county were unvaccinated. And so, sure, some of those people probably did have underlying conditions. But when you have 70 out of 72, that's well over 90%, clearly there's no question. If you are vaccinated, you are protecting yourself from hospitalization and death. And we just keep having to remind people of that. Just turning on a couple other things I quickly wanted to mention. When I was looking at the numbers that were presented, although we have done, I think, a great job of making sure that all segments of our community have been vaccinated, and particularly, as was mentioned, the Latino community. I think we've done it's great to see the numbers, but I did make note that of those that are partially vaccinated, there's a higher percentage of the Latino community that remains partially vaccinated. So that continues to be an area that when we're pushing for the partially vaccinated people, that we should particularly look at that when we're looking at outreach. Also, I noticed as far as unvaccinated, for the over 65 age population is, if I recall, it was something like 24%. So some of the people that are most susceptible because of age are some of the, age-wise, unvaccinated. And so that also is an area that we need to particularly target. And then, obviously, when we're talking about outreach, we need to be particularly mindful of how we're going to get the word out for the 5 to 11 years olds, because that's coming up, as was pointed out, very quickly, and I think that's a critical area for us to address. Make sure that those children are vaccinated as quickly as we can. Last comment. With the incentives being projected, vaccine incentives being projected to be exhausted by November 12th, I would like to suggest that we should have on the agenda, on the November 9th agenda, an item so that the board can consider whether we want to continue, the incentives, whether it be the current one or some other incentive, so at least that can be discussed. So I would ask that we get that on the agenda, and hopefully get support for that. Thank you, Madam Chair.
Supervisor Tiffany, if I could just build out on your comments and observations about underlying conditions. I think it's very important for the public to understand that hypertension, high blood pressure, if you're being treated for high blood pressure, that elevates your risk of a severe course with this infection. If you have asthma or other pulmonary illness, if you have any sort of cardiological condition, if you are a cancer patient and receiving immunosuppressive or immunological therapy, that could elevate your risk. So there are very common diabetes puts you at elevated risk of a severe course. These are highly prevalent conditions in our community. I think the U.S. figure is that approximately 65 or 70% of the American population has one chronic condition at least by age 50. And by age 65, that's usually two or more chronic conditions. So when we say that there are underlying chronic pre-existing illness in an individual who had a bad course with this infection, we need to understand that there's a very, very large segment of our population and our community as a whole, because unfortunately, chronic diseases are highly prevalent in our community and it's the state and the nation as a whole. Just wanted to emphasize that we're not talking about esoteric conditions here. We're talking about things that you'd be hard to find a family where there isn't a member of the family who has one of these conditions. Thank you.
Thank you, Madam Chair.
Madam Chair,
Hold on, Supervisor Hernandez. Supervisor Kozmicki had a question.
Oh, I have comments, not
Sure.
a question.
Okay, comment, go ahead. It's okay.
Yeah, just as far as the presentation part, I disagree on that. Normally, I would agree, if it's a presentation that's not an updated daily sort of situation, but in this case, 2/3 of the presentation are numbers that are, that are fluid, and that, if we get the presentation a week before, then the presentation is utterly pointless. So I just disagree on that. I don't mind if we get like a portion of the presentation, maybe there's the school part in there. I think that's pretty much the only part that maybe we could have had that a week ago. But if you look through the presentation, the vast majority of it are numbers. And again, they're changing every day. So I appreciate getting a presentation the day of. It makes a lot of sense. The vaccination rate looks good to me compared with where we were. This is a area where we were pretty far behind the state for a while, and now we're pretty much lined up with the state. So I just really glad to see that we're making progress and want to see us continue that momentum. I appreciate all the staff's work on outreach, and the incentive program to me has been clearly a success as far as getting our numbers bumped up and helping us along the way. I agree about the incentive program, so if needed, I'll be the second person to support putting that on the agenda November 9th. And then the outreach, appreciate the staff's work on outreach. The billboard, something I requested in particular, so thank you. That's coming pretty quick here. And then I agree on the school communities. That really, to me, that is the next phase where we really need to be focused on working with our school partners and making sure that we're all on the same page. All the school districts are on the same page as far as, getting the word out on the importance of the vaccine, putting out, trying to lessen the impact of misinformation and propaganda that's out there. And really just, to me, we really have to have an aggressive effort with our school age children to get them vaccinated, because that otherwise we could find ourselves, remember I guess it would have been in the spring, we were down to 0. We all thought we were kind of through this thing. There's ebbs and flows to this whole thing. So it's always possible that we could be, that we could see numbers go up again. And I certainly don't want to see that. As far as school goes, since, there's been a lot of discussion, we had, even today here at the beginning of our meeting about I do want to briefly address the Spring Grove situation. Unfortunate and sad, a young girl collapsed at the school, very serious, was life flighted to Stanford. My thoughts and prayers are with that young girl and her family. That's first and foremost. But with regard to the criticism from the superintendent's husband, and I think that's, something that we should be clear that we're pointing out when we get up and make these public statements, that you're the husband of the person who's really under the microscope here. The public deserves to know that. And as someone who came from a long career in media, I'd like to note the press release from the county on the situation was perfectly appropriate. There were questions about, information, but everything in the press release was accurate. So, it was a very serious situation. Somebody was life flighted from a public place. There's a lot of speculation going around. It's really our role to make sure that we're transparent about these situations and to let the public know that we as a county do have a role here. There's contact tracing that's involved, for instance, and I appreciate all the work that our public health staff has done in following up with that whole situation and the contact tracing with the outbreak that occurred at the science camp, and then this young girl having an unfortunate medical situation. We didn't release any child's identity. There are no privacy issues here. The county has every right to be involved and concerned due to the implications with wider community health, contact tracing, and the condition of that poor girl. And I had a parent contact me. So the Saturday before this terrible situation occurred at the school, I had a parent contact me very concerned about alarming messaging from the superintendent of that district as far as their approach to our COVID policies and the state's policies. And I've requested that County Public Health Department do a thorough investigation of that messaging from the superintendent principal that was really unfortunate, that talked about Spring Grove in particular looking at a workaround to the state's COVID policies regarding schools. And I want to make it clear from my perspective as one supervisor, the county will not tolerate rogue school districts defying rules meant to keep the wider community safe and the school community there as safe as possible. Thank you.
Supervisor Hernandez?
Thank you, Madam Chair. I would just like to apologize to the community for Supervisor Kosmicki's comments. They were out of line. They were completely inaccurate. I mean, it's funny because my question to him, which I don't expect him to answer, I don't want him to answer honestly because it doesn't matter, is did you even talk to the superintendent of the school district? Did you even address the concerns with her if you really cared about this little girl, which is tragedy that this is even becoming publicized? To be clear, the NICS report said it was a COVID-related emergency. And then our public health officer basically put out that sentiment, all of a sudden takes an interview where he says the child did have COVID, but the cause of a respiratory collapse is still under investigation. So was it COVID-related or was it not? Why would we put out a statement when we're under? So it's creating a lot of presuppositions. The reality is this little girl had nothing to do with the three. There was contact tracing of those three. It was separate situations. She didn't even test positive till way after, obviously, after this emergency. So all of a sudden, there was a convoluted, basically, reality. Let's put it this way. There's a reason why the PIO position is changing, because that messaging was failure, and it proves that if we're not careful and if the board majority doesn't make a decision about even our messaging, then we could create more damage than we can actually solve, right? The issues that happened. Right now, we basically have a school district. And for Supervisor Kosmicki to say a rogue district, we have no authority over the school district, zero. To make that statement is fictitious, and by default, it's only intent on creating division. And I'm just calling it as it is. When it comes down to the comment that Supervisor Tiffany had mentioned, there's nothing wrong with telling the truth. Actually, I would think that would be an actual virtue, is to be truthful. What I shared was truthful, and public health literally articulated, yes, you are right, Supervisor Hernandez. So when you're talking about misinformation, Supervisor Tiffany, that's really a big letdown, because you told me in person, Peter, I really want to work with you. That's not someone who wants to work with you. Someone says, we need to, in my home, my son or daughter know that they don't lie to me. And lying isn't just not telling, basically outright lying. It could be not telling me the whole truth. That's what we're doing to the public. We're not telling them the whole truth. And it's been honestly a big disservice to our community because it's only divided us further. So those are my only comments, Madam Chair. I had to answer those.
Supervisor,
I had to answer those.
may I just respond to your comment very briefly? I just want to share that the content of the press release was valid. It was factual. The use of the term COVID-related was unfortunate in that it created a misperception. When we said it was, and again, this is our PIO did this. He did this in, desire to move rapidly and communicate with county residents. The COVID-related is to the fact that there was an outbreak at this school, at the science camp. There were 3 cases, and this child was among them. And so if we had not communicated to our community at large in a transparent manner that this child, very unfortunate, I concur with you, it's tragedy. But if we had not communicated that this was at a school where there was a recent outbreak and that this child was one of the cases in that outbreak, from my point of view, it would have been negligent, public health negligence, because we owe the community all of the facts, and we need to be transparent. So the actual wording is COVID related, and I clarified this in the interviews I did, 3 media interviews the following days, that only the clinicians at Packard Children's Hospital can identify what the cause of this poor child's collapse was. And then, of course, the parents need to, as her legal guardian, authorize or not the disclosure of that personal health information. But in terms of the communication, I can only imagine that the outrage that would have occurred had we not, in the public health, let the community at large know that this was at a school where there was a recent outbreak and that this child was involved. That was the underlying intent. The wording could have been crafted better. I grant you that. And I endeavored, on my part at least, to correct that in the subsequent days. And moving forward, I can assure you, I've asked the PIO to share with me all sensitive communications on any outbreak, whether COVID related or not, just to make sure that the precision of the wording could not offer any potential misinterpretation. But certainly, I remain firm in the fact that we did need to share this with the community. Everyone has the right in the community to know that a child collapsed at a school where there was a COVID outbreak in recent weeks. Thank you.
Doctor, I 100% agree and appreciate your earnestness. I definitely don't want to disrespect your position. And I would agree with you that the message probably didn't need to happen. My biggest point with everything that I said is, if we truly want to be a healthy community, then we need to have better communication. This happened in a way that I think created more damage than it actually solved. I mean, if it needed to happen, I recommend that wherever it's happening, that we don't have public health administrative staff talk to to our superintendent. It should be you, doctor. And I'm not saying that didn't happen, but for what I'm hearing, there was basically broken communication, and the county didn't even reach out to the superintendent until, pretty much the Nixle report had already went out there. So even when it comes to messaging, that's really important, right? Because they did the contract tracing, and you're right, this little girl went to the science camp. My biggest point in mentioning is she was separate from those 3 initial cases where they were already contact traced, and that's why this created so much confusion. So granted, she was there, and maybe they needed to put out a message, but it was just, there was individual pieces that weren't necessarily consistent, and we put it out as if it was, and that's what confused the public. And I think just my biggest point is if we can please work at actually communicating with the individuals that we're talking about, because I don't think it's going to unite us. It's going to divide us when we don't do that. Thank you, doctor.
Thank you. And I think we can agree on that point. We're entering the 3rd year now soon of this pandemic and our management of it. And it's a continuous challenge. And there are always opportunities for imperfect communications, whatever the intent is. So I agree with you that there's a best practice learning here. And I will ensure personally that this kind of imprecise language is not used in the future.
Thank you, doctor.
On that note, we're going to go ahead and go to public comment.
Madam Chair, we just have one more item.
Yes. Edgar was trying to present.
Edgar Nolasco, our deputy CAO, has just a few more things to say. Thanks.
Good morning, Madam Chair, members of the board. If CMAT can please share my screen, thank you. That doesn't look okay. That looks a lot better. Thank you. We're here to give you an update as your board recently, as of August 24th, passed the San Benito County testing policy for all county employees. We wanted to provide you an update of what is going on with our workforce. And these are some numbers we wanted to share with you. We currently, and this number fluctuates, we have 535 employees. That is full-time employees, temp employees, and other employees that are designated under our policy. Out of those 535, 65 of those are subject to the vaccine mandate with CDPH. CDPH passed a vaccine mandate for behavioral health on August 5th. We went ahead and implemented that enforcement. 65 of our employees are mandated. No action of the board. That was done by CDPH. Out of the 535, 446 have self-attested that they are fully vaccinated based on the definition. Out of those 446, 431 have verified their vaccine status using the CDPH vaccine guidance principles. 15 of those employees have yet to produce those records. We're working with those employees. It's a failure of communication sometimes with those employees, and some of those employees have odd schedules where they cannot make it down to administration on a regular business hours. So we're working with some of those employees to meet outside of our normal business hours to verify their vaccine status. 86 employees are currently testing bi-weekly, and many thanks to our Health and Human Services colleagues. They have a testing site over there to test employees that are subject to testing based on their self-attestation form, like RMA employees, behavioral health employees, Health and Human Services employees are testing at Health and Human Services. All other employees are testing here at administration. Some employees are testing in remote locations because of operations, like our roads department. We have testing, we accommodated testing at the site just because it would be operational impossible for them to come in and test here. So we worked out working with Mike Chambliss, we're testing our roads people at the yard. Additionally, our corrections and probation folks are testing at the jail because they run on different schedules for those folks that need to be tested. Out of all of our population, we are missing 3 self-attestation forms. We're working with those employees and those individuals to get those attestations forms. 2 of them, my understanding, is a miscommunication. They never received the email where they needed to fill out a self-attestation form, and I expect those to be filled out by today. Also, a small update on the exemptions. We've only had 1% of our employees file for exemptions. That's 6 of them. Only out of those 6, only 1 of those is subject to the mandatory mandate through CDPH. Out of those 6, 5 of those are religious, 1 is medical, and we're working with those individuals to gather more information to continue the accommodation process based on the information that they submitted. And I'm opening it up for any questions or comments.
Thanks, Edgar, for working on that, getting that to the board.
Any questions from the board members regarding this presentation?
No, I just want to thank Edgar for pulling that together. That's very helpful. Thank you.
It's a team effort. I say a lot of thanks to County Council. They've been working with us, Health and Human Services, the entire CAO team, putting this together. It's a team approach.
As well as all the employees too, for going through the process and testing.
Yeah, and it's great to see that the vast majority of our county employees are vaccinated. Thank you.
Okay. So then on that point, if there aren't any further questions, let's go ahead and go to public comment then on any of the presentation for item number 3.
If you'd like to make a comment in chambers, please provide a speaker card. On Zoom, press star 9 on your phone or the raise your hand icon on your screen. We have Robert Bernoski in chambers.
It is so hard for me to be polite. How dare you condemn anyone involved with this? And yes, I am the husband of the superintendent, the same person that shares a house, shares a bed with that superintendent, and when she's down there doing CPR with her fellow administrator is that close to that student that was hurt, I think I have a right to know what the student's condition is. Furthermore, as somebody who went to science camp, I think I have a right to know whether the student was one of the students that had an outbreak there. I'm not going to break the student confidentiality, but I heard an outright lie stated here for the world to say. So your Texas doctor, who I should have a lot of respect for, he better have his facts right, because I don't think that they are. But folks, just think about what you did. You issued a press release to get the alarm going. The doctor had to walk it back on TV, but that wasn't good enough. You still have to be at war with Rob Bernowski, I guess, or war with the public. So you go on Telemundo, and I guess it was Telemundo I saw, and you make, again, factually incorrect statements. I reached out to my supervisor, I reached out to another supervisor, I tried to reach out to the administration, but no, you want to ignore it because it doesn't fit some narrative. Folks, do your job. Let's keep the decorum. Yes, I am the husband of Jenny Bernowski. Proud of it. I will never shy away from that. And yes, when I know facts that might help you guys manage the county and manage the situation, I'm going to relay those to you. I didn't break any confidentialities. I wasn't telling any secrets. I wanted to help solve the problem. So I'm Rob Bernowski. I'm pro-vax. I'm my body, my choice. Make the choice to get vaccinated. I'm not some nut job that's trying to go against you. I'm trying to help my community. You folks serve us. Allow constituents to talk to you. Do not degrade them just because they're a member of the public that happens to be married to the most significant person in this. Thank you.
Thank you.
Alia Salinas?
Thank you, Madam Chair and Supervisors. Excuse me. I can understand Rob's emotions right now, but at the same time, what's more concerning to me is that this child's condition has been politicized, and Supervisor Hernandez claims that he had a conversation that he wants to work with the board, yet he's the one who's being divisive. This is what started. I put the branch out, an olive branch out in January of 2020 because I was really, really critical of Hernandez's lack of understanding and lack of trying to get himself educated on the subjects that were coming up here on the agenda. Now for him to come out here and the first thing he does is he claims he's not a doctor. That's correct. He's not a doctor. He questions the doctor corrects him, and yet he turns around and he's like, well, I still don't believe it. Well, that's the problem with Supervisor Hernandez with this issue this year. In 2020, no one expected this to happen in the entire world. This is not just a San Benito County, but this is where we live and this is where it's affected us. And Supervisor Hernandez, of all the supervisors out there, knows exactly what happens when you get COVID. And he says he wants everybody to be honest, yet he hasn't been honest. He got COVID, not once, but twice, and he got really, really sick, and he lost muscle mass. He was on the meetings on Zoom, and you could tell he had problems breathing. He could barely speak, and yet he comes out and tells everybody he wants the truth. What the truth is, Peter Hernandez needs to come forward and be honest with the public.
On Zoom, if you'd like to make a
Madam
comment.
Chair, just for
Can you hold that, please, Supervisor Hernandez? Continue on, Madam
yes,
Clerk.
Madam Chair.
On Zoom, if you'd like to make a comment, please press *9 on your phone or the raise your hand icon on your screen. No comments.
Okay, Supervisor Hernandez.
Yeah, I'll just make a very quick point, Madam Chair. Ms. Salinas just lied. Second time she lied. It was just an outright lie, what you just mentioned. That's all. Thank you.
This issue is just so divisive in the community. I'm just going to try to make sure that we just stay on point, we stay on fact. If we're messaging from the PIO, It's imperative that it's truthful, so that we have no distortion of the facts, and it's a no-win situation for me. So I'm going to keep my comments to themselves, to myself, excuse me. And so that was a presentation and update, right? There wasn't anything needed
That was
to-
it, yeah. And what we'll do is we'll come back with the ARPA outline, and be prepared for the next meeting on that. Yep. That's all, Madam Chair. So we're ready for the next item if there's no other.
Okay. Item number 4 then.
Next, we have our RMA Interim Director, Mike Chambliss here, and Selena.
Good morning, Madam Chair, Board. Selena is going to provide you with an update presentation regarding Senate Bill 1383, which is the methane and organics recycling law that passed back in 2016. We're going to be having some items come before you over the next few months and some decisions. So she's just laying the foundation and here to answer specific questions regarding the legislation. Thank you.
Good morning, Madam Chair, Board. Please just give me one moment to put up the presentation. It looked like there was some issues. I think it's slideshow. Okay. This morning, I'd like to provide you with a brief presentation on California's Senate Bill SB 1383, also known as California's short-lived climate pollutant reduction strategy. This presentation will include some definitions, history, upcoming requirements, and recommended next steps. It is our recommendation that today you adopt the resolution affirming a rural exemption from the requirements of mandatory organics collection and other related SB 1383 activities on behalf of the regional agency. But first, a few clarifying definitions. Organic waste. This is a mixture of yard waste, wood waste, fibers such as paper and cardboard, food scraps, and also edible food. Organic waste is one of the largest waste streams in California, accounting for roughly 1/3 of the waste going to our California landfills. Sadly, California throws away more than 6 million tons of food waste every year, while millions of Californians are food insecure. When organic waste is landfilled, it later decomposes and emits methane gas, a short-lived climate pollutant that is 72 times more potent than carbon dioxide and contributes to climate change while negatively impacting our air quality and public health. Landfills are responsible for 21% of the state's emissions, methane emissions, and are the 3rd largest producer of methane. Overall, there is a lot of usable organic material being disposed that can either be rescued as edible food or that can be composted. These SB 1383 regulations I'm about to share with you are a win-win for public health, feeding those in need, and fighting climate change. SB 1383, an unfunded mandate, was signed in 2016 to reduce emissions of short-lived climate pollutants. I'll note that SB 1383 is really an extension of AB 32, California's Global Warming Solution Act of 2006, which first established California's ambitious climate goals. However, this bill focuses on the solid waste side of emissions. SB 1383 is the most significant waste reduction mandate to be adopted in California in the last 30 years. The bill focuses on 2 main methane emission reduction targets. 1, the reduction of organic waste to our landfills, and 2nd, the rescue or recovery of edible food from our landfills. You can see here the statewide targets established include a 50% reduction in landfilled organic waste by 2020, and then a 75% reduction by 2025. Additionally, by 2025, there is a goal of increasing edible food recovery by 20%. Per SB 1383 regulations, there are extensive requirements for local government, businesses, and our residents. This slide here provides a basic overview of those requirements. On the left side, you can see in 2022, just around the corner, SB 1383 will require local jurisdictions to have their programs in place, such as providing organics collection services to all of our residents and businesses, It will require cities and counties to establish an edible food recovery program where applicable businesses will be required to recover edible food, maintain contracts or agreements with receiving organizations such as our food bank, and keep food recovery records. There is related education and outreach we must conduct to organic waste generators, such as regarding collection service requirements, edible food donation requirements, and overall compliance with SB 1383. City and county facilities will be required to procure recycled content paper and recyclable paper, recovered organic products such as compost and renewable gas made from biomass conversion. And additionally, there will be capacity planning requirements for organics processing and food recovering infrastructure to secure access and recovery programs. There is some competitive funding that will be available for establishing this infrastructure, or that may be used. We will be required to update our county code as 1383 requires us to have enforceable mechanisms in the form of penalties for noncompliance. And then by 2024, regulations will require local governments to take enforcement against any non-compliant entities. This, I'm sure, sounds like a lot. I know it does for me. The hopeful good news is the regional agency does qualify and may apply for a rural exemption that would exempt us from many of the SB 1383 requirements that you see listed here and on the prior slide, but not all. The rural exemption, if granted by CalRecycle, would exempt the county's integrated waste management regional agency members, which include the City of Hollister, the County Unincorporated, and the City of San Juan Bautista, from the mandatory organics collection requirements and other associated requirements until December 31st of 2026. If granted the exemption, we would still need to comply with establishing an edible food recovery program with enforceable mechanisms and inspection, and 2, establish procurement policy for recycled content paper recyclability at our county and city facilities. Ideally, compliance with these requirements would be by January 1st, 2022, or shortly thereafter. Upon approval of the rural exemption, we would be exempt from other SB 1383 related requirements until 2027, or until we reach a population of 70,000, whichever comes first. As for recommended next steps, we first recommend today that you approve the resolution affirming our rural exemption on behalf of the regional agency. This will allow our cities and county additional time to plan for programs and compliance, as well as provide continued education for what's to come to our local businesses and residents. And then next, we will be returning to the board in each city with within the next month for review and approval of a memorandum of understanding between each RA member outlining roles and responsibility for SB 1383 compliance. An adopted MOU will be required in order for the regional agency to be eligible for a rural exemption. And the board and city councils will hold ideally a first hearing at that same time of the Edible Food Recovery Program ordinance, and we would then plan for a second hearing in January. Also within the next month, a separate but related presentation and potential project development agreement will be brought to the board for approval in efforts to explore our regional agency organics infrastructure needs and planning. And lastly, even with the rural exemption, we do not want to wait to comply until December 31st of 2026 or until we reach 70,000 in population. So we'll be working with our new solid waste consultant, R3 Consulting, on a compliance schedule for SB 1383, and we will present that to you at a later date in 2022. That concludes our potential next steps and presentation. This was just a high level of SB 1383, but I'm happy to answer any questions. You'll be seeing a lot more of me over the coming months, and we'll provide more detail as we move forward.
Okay.
Madam Chair, I had a question.
Yes, Supervisor Hernandez.
Yes. Well, this one's to the CAO. I saw that it said unfunded mandate that's non-applicable. I have a hard time believing that's not going to be the case in the future, but I don't know how it pertains to maybe just because it's a presentation, or why does it say it's not applicable?
Selena?
Can you please restate that question?
Yeah, just because basically our agenda item says that this item it's not applicable whether it's funded or not funded, right? If it's an unfunded mandate or if it's not, and I have a hard time believing that this is in any way funded.
Yeah, so for this presentation, for the work we're doing right now through R3 Consulting, working to have the compliance schedule, that is within our budget. We've put in our budget additional staff time,
Nice.
the contract with R3. So that is funded, but
Got it.
yes.
Yeah, got it. Okay, thank you, Selena. Yeah, so but basically, once we get to, and that's my question to you, is you're mentioning an edible food recovery program. That sounds like a lot of work and cost. I know as a small business owner, this is something that I've struggled with because usually it's the state tells us what to do and we got to spend the money as a business owner on how to figure out how to do what they say. So can you explain what an edible food recovery program is?
Sure. So at this point, we're working with our food bank to understand the needs, the capacity, but the edible food recovery would require Tier 1 and Tier 2 businesses, which can, I have a map here. I think there was one available in the presentation, but would require those tier businesses to comply with, they would have recovery agreements with the donating, sorry, let me restart. I'm just going to move to that slide.
Displaying it?
Mhm.
Can you make sure you display it? Thanks. Yeah.
Okay, it looks like the slide might have been taken out here. Please give me one moment. I think it was in the old one, yeah. So edible food recovery organizations, we would be looking at the capacity planning for that. And then for restaurants, applicable hospitals, hotels, they would be required to recover edible food. And working with our food banks, they would have agreements between the two. And then they would be reporting to us on the recovered food annually. And we would be an entity within the county or the regional agency would be inspecting for those agreements and we would be making sure folks are complying with reporting to us the food recovered. Does that make sense? Should I elaborate at all?
Kind of, sort of. So, okay, so in the practical situation, a business doesn't sell their food, I'm assuming, so you're wanting them to not throw it away, you want them to give it away, and they have to package it and then get rid of it that way, or is it they have to throw it away, but it's a different process to throw it away?
Looking at edible food recovery, not food food scraps or food. Let's say there's a buffet that is not deemed edible because it's open. There needs to be certain requirements, health requirements. So we would be looking to recover that, and every reporting entity would be required to recover a portion of their edible food, ideally to meet these state goals of 20% food recovery.
So whatever they don't sell, is that what you're saying? They have to give it to the local food bank, and there's got to be a process to do that?
Yes. Yeah, and at the next presentation within a month, we're going to be focusing on the edible food recovery requirements in more depth with an ordinance sample for the first hearing.
Okay. Thank you, Selena.
Any others?
Just to sum up quickly, if we approve this exemption, how much more time does it give us to meet the requirements, and when do we expect to meet them? I mean, it sounds like there's quite a bit to be done.
Yeah, so with those two requirements I mentioned, we would still be, the exemption wouldn't exempt those, the edible food recovery, the paper
Right.
procurement, but for everything else, we would have until 2027 to comply, or until we reach 70,000 in population. So we're under that right now. But again, we don't want to wait until that date. We're going to work on a compliance plan to get ahead of those dates. And we're reporting to CalRecycle annually. April 1st actually is the first date that CalRecycle wants to see our plan for compliance and know where we are initial numbers and more.
Okay.
So that'll be the first
And as
time.
you point out, we're going to hear a lot more about this going forward.
Yes, a lot
Okay.
more. I'll be here probably every month.
All right, thank you.
Any other questions? Supervisor?
Just comments.
Okay, go ahead.
Madam Chair, thanks. So I support the exemption. Just we're a small county with scarce resources. It just makes a lot of sense. The other requirements, 2022, just want to say I have full confidence in our staff, and it seems like those areas are right up your alley, basically, as far as the programming goes. I also would just add, I wouldn't count on the 6-year, having those 6 years looking at the number of homes we have in this community, we're going to probably hit that 70,000 mark well before the 6 years. Thank you.
If I can respond to that question? So, a lot of responsibility is gonna fall on IWM, but, each department is gonna need to understand how this also affects their role, their responsibility. So we're gonna be, in addition to going to each city council, the Board of Supervisors, we're also gonna be meeting with several regional agency departments to talk about how it affects all of us over the next couple of months.
Okay,
Selena, I had one quick question, Madam Chair.
go ahead.
Yeah, are you going to be meeting with the businesses on educating them what this means anytime soon, or even just a proposal?
We're doing monthly reminders in the chamber newsletter right now, and what I would like to do, something that Gilroy Chamber and the Morgan Hill Chamber, is a workshop with our business community, and we're hoping to partner with the chamber and the Hollister Downtown Association, the San Juan Batista Association, to get the most attendance and promotion of such a event.
Thank you.
Okay. So let's go ahead and go to public comment then.
To make a comment in chambers, please provide a speaker card. On Zoom, please press the raise your hand icon on your screen or *9 on your phone. Thank you. Elias Salinas.
Thank you, Madam Chair, Supervisors. So this edible food recovery program sounds fantastic, right? But San Benito County's small businesses, restaurants, even the ones that are, franchises, they have a very small margin, so I know that this is going to be an expense on them. I'm all for the exemption, of course, but San Benito County residents already pay a fee to Recology for those green waste containers, and they went to all the meetings every time they want to get a raise, and what we're supposed to be doing with those green containers, and they're huge. They're not small. They only have one size. So does this mean that, and I knew for a long time that Recology was way ahead of themselves. They came up and they said, this is going to be the future, so we're going to start doing it now. And so they put all these cans out. The recycling containers are also large. They're not small. So I would like to have a future meeting where the Board of Supervisors have a discussion with Recology with regards to now this coming up about the residents getting rate reductions if something else has to be done. Because as it is now, Recology continually gets a rate increase every single year, and we're stuck with them for more than a decade, if I remember correctly. So how does the county benefit, the county residents benefit, and how do the restaurants, the businesses benefit without having to have more cost out of their pocket? And if so, can the rates be decreased based on this new bill? Thank you.
I don't want to speak for sure, but at this time, with the Recology franchise agreement, which was a contract proposed by Recology and worked through with our local task force in hopes to prepare for things like this and fund programs like this that might be coming, additional staff. We have received new revenues from that franchise agreement, litter abatement, AB 939, HHW, and so again, at this time, I don't foresee that affecting our rates during this contract period, but I think with our work with the consultant, discussions with Recology, we'll know for sure. At this point, the requirements for organics collection to our residents are required, and so they're compliant. But with businesses, it's optional, and it's actually, organics is placed at a reduced cost in comparison to garbage. And so if they're able to decrease their garbage, increase their recycling, a lot of businesses can save money by adding organics and increasing their recycling. So that's a win-win for businesses, but again, more discussion needed with R3 and with Recology.
On Zoom, if you'd like to make a comment, please press star 9 or the raise your hand icon on your screen. No comments.
Okay. So if there aren't any further comments or concerns, we have a staff recommendation to adopt the resolution to affirm the exemption. What is the will of the board?
I'll move to approve as recommended.
I'll second that.
Okay, so we have a first and a second. All in favor?
Aye.
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 4-0.
Thank you.
Thank you, Selena. So that takes us to item number 5.
Yeah, thank you, Madam Chair. So we're just going to do a quick update. Our clerk of the board has just a quick item to discuss with your board concerning this item, and then we'll defer it back to the to your board for updates on your monthly ad hocs and committees that you've attended. So, Jennifer?
Thank you. Good morning, Madam Chair, members of the board, and members of the public. I'm here today just to give you a quick update on our standing committees. I just wanted to make it aware to the board and to our county staff and any agencies that might run a standing committee meeting that they must follow the Brown Act, which means they need to provide an agenda and minutes. So just wanting to make it aware, if you see a committee on this list, that you do need to follow the Brown Act. We do have this on our county website, so you could check it out. So standing committees, they must follow the Brown Act. Agenda needs to be posted 72 hours prior to a regular meeting. An agenda needs to be posted 24 hours prior to a special meeting. And we are asking if you are having one of these meetings to please provide the clerk of the board's office with an agenda, and please provide the minutes in a reasonable time after the meeting so we can put it on our website under the minutes and agendas and minutes tab for each committee. I will be following up in our office with all the contacts for these committees individually, just so they are aware too. And just a friendly reminder that there's still open vacancies for Parks and Rec, District 3 and 5, Community Action Board, District 1, 4, and 5, and the LCA Committee for District 3. If anybody's interested in putting in an application, you can get one at the Clerk of the Board's office or on our county website under the Clerk of the Board, where we have the applications. Is there any questions or concerns? If not, I will hand it over to your board to give an update for the ad hocs.
Thank you, Jennifer.
Thank you.
We'll hand it back to you, Madam Chair.
So I know that there's some updates that are required, so, or that wanted to be presented. So where would you like to start, gentlemen?
I can start, Madam Chair. Just some quick updates. This already has been mentioned, but the Economic Development Ad Hoc Committee actually met yesterday specifically to discuss more details about the changes in the cannabis ordinance, including looking at outdoor cultivation, and as mentioned, that's going to be coming in front of the board at our next meeting. I know that I believe in the next few days, Supervisor Gonzalez and myself will be meeting to further discuss the American Rescue Plan money, and I know we're wrapping up getting input from the community on that, and so look forward to getting more into that very important issue. Obviously, as mentioned, we've already been, regularly meet with COVID ad hocs. We've already addressed that. It was mentioned again, I think we're very close on the tax share agreement, and hopefully we're going to see that at our next.
That's the plan. So we're meeting with the city tomorrow to discuss it internally. We'll probably have a meeting one more time with the ad hoc and then bring it back to the board.
Okay.
Yep.
So looking forward to getting that. I already mentioned I serve on LAFCO, and we are having, I think, an important and maybe the first time ever joint study session tomorrow evening at 5 o'clock. That is open to the public. It is also available on both Zoom. It's at Ridgemark. And of course, we will all be following, the Brown Act, et cetera. But it's an informational meeting more than anything else on LAFCO. Regularly meet along with Supervisor Gonzalez on the Behavioral Health Board, and we had meeting last week. And I think we're talking about some important issues regarding increasing the number of clinicians for, in particular for the Behavioral Health Board. Like many areas of the county, we have struggled with trying to fill positions, and so that's an area that we're particularly looking at for the Behavioral Health Department. I also serve on COG, and the primary issue there, I think, is to try to see what we can do to cut down on the timeline for dealing with Highway 25, and that's something that we're working on. I think most people know that 156 is construction is soon to be started. And also, just to mention that although this is not coming from us locally, Caltrans is going to soon be starting with a roundabout at the 156-25 juncture. I think that's soon after the first of the year, I believe. And then lastly, we've had a landfill committee meeting just recently. Just an update is it looks like the draft EIR will not be out until probably March of this coming year, so we still have a number of months out there. It's an indication that the time is being spent to make sure that it's a very thorough and robust EIR, and that all our alternatives and mitigation issues are being addressed. So again, probably in March is what we're looking at. And between now and then, there's a lot of discussion, a lot of plans for trying to get as much information out there to the public, the history, the facts, how we are where we are today, and just educate the public so everyone can make informed decisions. When the draft EIR comes out, I want to assure everyone there'll be plenty of opportunity for anyone and everyone in the public to comment before it goes to a final EIR. And that's all I have. Thank you, Madam Chair.
Okay.
Madam Chair, thank you. A lot of mine, I won't repeat a lot of what Supervisor Tiffany said, but I just so people know, I'm working on the cannabis thing is economic development. The landfill, just a slight correction, I think it's May when the EIR actually comes out. We were talking about maybe doing the town hall in the area of March. So look out for information on that. That's our efforts to try to be as transparent as possible throughout this process. And then the tax sharing agreement with the city of Hollister, again, very big deal, and I'd really like to see us get to that hopefully in November. I know we have a lot on the plate in November, but to me, the tax sharing agreement might be at the top of the big list.
Plan is the first meeting in November. That's
Great.
our plan.
Yeah, appreciate that. And then I'm also on the Integrated Waste Management Task Force, and the task force is there's a consultant that's looking at initial stages of a potential, speaking of organics, of a potential transfer station for organics near the Hollister wastewater treatment plant, and I'm sure there'll be more to come on that. And that's all I have. Thank you.
Supervisor Hernandez?
Yes, thank you, Madam Chair. I'll be brief with mine. The tourism ad hoc, which you're on, we have momentum. It seems like we're getting everything lined up. We have about 60 interested folks, businesses, on that next step with the tourism company that we're working with to ultimately have a symposium where we're going to have dialogue about what it means to support and address tourism in San Benito County. And then the broadband, as you're on also, is we're working still on that RCRC study, basically where we're going to figure out what would be the plan for San Benito County to address broadband in certain areas that are basically not as densely populated and where folks that are socioeconomic struggling, basically that don't have access. So to try to address the access issue. And then the regional parks, obviously, that's really exciting. There's already I know that Mike Chambliss was working on a draft brochure, and I think we should be hopefully finalized pretty soon on putting it out there, getting the public excited. I know that we already supported, obviously, that $700,000 to that lawnmower, which is a lot of money, but it's really important, I think, to address dry weeds and stuff. Obviously, thank God we're in the rainy season now, but ultimately getting ready for that park to start to get built out. And I know in that brochure they actually have a layout of the timeline, the expected timeline on when these funds would be spent. And thank God we actually received that $750,000. And I know it was also with support of Assemblyman Rivas. So thank you to him for supporting those funds. To get that regional park to become an actual reality, which is, I'm really excited. Next year is going to definitely be a big game change as far as the visibility in that area. That's all I have, Madam Chair. Thank you.
The committees and the ad hoc that I'm involved with is, as Supervisor Tiffany had mentioned, the ARPA funding. We haven't quite met yet, but we are meeting soon, and we will be taking into consideration the polls that were, the surveys that were put out, and how the community wanted to focus on it. As Supervisor Hernandez mentioned, it was my understanding there was a request to have a meeting this afternoon this evening after today's meeting regarding tourism. So that'll be happening today, it sounds like. I'm also on AMBAG. We meet monthly with Supervisor Tiffany on that one. And so that's a very interesting one. The behavioral health, we also meet there monthly. And as Supervisor Tiffany had mentioned, that we are looking at staffing and the ability to be able to provide the services, the level of services that are necessary here in the community. I'm also on the CSAC. I'm the delegate for CSAC. There is a conference that is happening the last week of November, first week of December in Monterey. I also am on the First Five committee. We just met on Monday, yesterday. I'm on the Community Correction Partnership, which is also part of the Juvenile Justice. And there are quarterly meetings that I have been attending, but the partnerships are meeting on a monthly basis that I'm not attending, because that's more micromanaging. I'm not trying to micromanage a program. The governance committee was just set up, and that'll be dealing with water issues in San Benito County, San Juan, and the city of Hollister. As Supervisor Hernandez mentioned, we had a broadband meeting last Friday. We met with the members of the task force, and it was a nice showing of individuals from the community that will represent those agencies, firms that will help us potentially solve the broadband issue. We also had a member of Ana Caballero's office that he addressed the SB 28, SB 28 that's dealing with the areas in the community that I can't even think of the name of the agencies that provide internet, satellite, technology to the communities. Telecom, thank you, that provides services, and wherever there are voids and areas where there isn't any service.
The franchise
agreements,
Yeah,
yes.
that's correct.
I'm also a member of LAFCO, and we have that joint meeting that will be happening this week. And that's pretty much it. Mobility, we meet quarterly, so we'll be having one, I think, in December, if I'm not mistaken. Okay. But anyways, the question I asked for this one is, I know that, that there was a question as to how frequent do we want to have this on the agenda? So this is the conversation that I would like to have with the supervisors presently. As I know that we had mentioned possibly having the ad hoc update at the end of the month, but then there was some concerns that it should be every meeting. It doesn't matter to me, but I want input from the remaining supervisors to see what your thoughts are. I know that as we give presentations on our supervisors, item number, let me get to it.
3, is it 3 COVID?
No, I'm thinking more G, item G at the very beginning. We do board announcements, and that's supposed to be information only. We're kind of delving in the area of the ad hoc as well as the board announcements. So just for clarity, so that way we don't get accused of presenting something that isn't on the agenda. If it's something that we participated in, it stands to reason that we should be able to share it. But it seems like it's getting a little bit convoluted, and so I want to hear your thoughts on that so that we'll make sure that we are consistent in how we're presenting. And so, questions, concerns on that topic?
Madam Chair?
Yes.
I think once a month is fine as long as it's clear. And then, I've been trying to not do ad hoc stuff in my announcements as you saw today. So as long as we're clear, I think once a month is definitely suitable for ad hocs unless there's a level of urgency, and then we just put it on the agenda. So, thank you.
Yeah, I understand where you're coming from. I could go either way, frankly. I mean, if we do it quickly like we just did, or like we're doing, we do it every meeting, but I know we're trying to be more time efficient, so once a month, and we can be careful. I guess the only issue would be is if something's important to be brought up that comes up that's not on the agenda, and then you don't have the opportunity. But the way I understand it in talking, I was talking to you separately, that I think as long as we don't the way I understand it, as long as we don't really kind of step out of the, and really get into great detail during that board announcement, if we have something important and it's not the meeting where we're getting into ad hocs, I don't think there's anything wrong. I don't believe there's anything wrong with us briefly mentioning something on, that's related to ad hoc. I mean, we're so involved in these committees and the ad hocs that it's almost impossible to separate, what we're doing and just say, well, we're only going to talk about it once a month.
Mm-hmm.
But as long as we can touch on it in the board announcement, again, in a meeting that we're not dealing with ad hocs, I'm fine with doing it once a month. That was a long answer.
Yeah,
Sorry.
yeah. And if I may, Madam Chair and Board, I think that's great. That's fine. That's historically how the board's always done it with board announcements, keeping it just to the point. Hey, this is what's happening. This is, oh, by the way, here's an event, or I attended an event, or give an update to the board. Totally fine. I think is when you start pulling the PowerPoint up and you start going through numbers and start doing a lot of detail, that's when all of a sudden we need to pull back on that and just kind of keep it, just kind of an update. That's really what it's there for, as an announcement. So I think that's basically what you've been doing, so I think it's fine.
Part of my concern was today, like the example where we had the presentation from Tracy and Dr. G, and then the conversations went off into the Spring Grove example. I sat here and just listened, because I know that it was a controversial issue. It was a miscommunication of some sort. It caused static in the community, and so I wasn't part of it. So I pretty much just let you all speak, but it's like, where do I, as a chair, draw the line? And I know everybody felt that they needed to express themselves, so I just left it. But I'm getting correspondence accusing me of censoring my supervisors, and I'm not trying to, but it's just a very difficult line, so I'm just trying to keep everything out.
Madam Chair.
Yes, Supervisor Hernandez.
Yeah, honestly, I think you did a really good job of handling that conversation. It was relative to the item, so I don't think it was outside of it. But to get back to what the goals is. When it comes to the member reports, and just historically, as CIO Espinoza had mentioned, the initial item that's just updates, it's specific to events that you're part of, things, maybe a grievance from an individual constituent, maybe referencing an issue, or hey, this is an emergency. I saw that stop sign that was down and we need to fix that, or maybe something quick and to the point. Ad hoc stuff is obviously more, you expand more, and that's specific to committees and ad hocs. And then there's still that final item where you have your piece of your opportunity, which is something that you would propose as an agendized item for future. And it's, obviously the focus should try to be as much as possible to be objective and not get it into emotion and subjectivity, which is hard to do sometimes, but nonetheless, that's kind of the structural that I've kind of been used to, being here 3 years now on the board. Thank you, Madam Chair.
Thank you. Okay. So then let's go ahead and go to the public comment on this item number 5.
If you'd like to make a comment in chambers, please provide a speaker card. On Zoom, press star 9 on your phone or the raise your hand icon on your screen. Elias Linas.
Thank you. There's never been an issue until now, and I don't really think it's an issue. It's like board announcements. If you're on an ad hoc committee, you report it. I want to hear it every time I come to a meeting. I want to get an update personally. And I don't want to have to wait for 4 weeks to find out that 3.5 weeks ago, y'all did something on your ad hoc committee when you could have reported it, 8 days later at the next meeting. With regards to using your time wisely, again, I'm a little, I get taken aback by that. I know exactly what you're trying to say, that you want to get business done. But at the same time, if you're trying to say that if you have an agenda item for ad hoc meetings reporting once a month, that's going to make your meeting shorter. I advocated that this is a full-time job and you should be compensated for said, but since that has occurred, this new board has decided that they want to do as little as possible, and I find that odd. You guys work a lot. I know that. But, you want to, I only have 42 seconds left because now I can only speak for 2 minutes. I have a lot to say, and I'm not the only one. There's a lot of people out in the public. And I, for instance, to me, the tax sharing agreement is really important. Very, very important. I want to know what's going on with it, but I have to wait. And you guys, are talking about it. And not knowing that you guys are meeting makes me anxious, and I want to know that something is going forward, because I know that the city wants to take advantage of that, and I don't want, and the county is has to take care of itself with what you can do with the tax sharing agreement. So I want to know more often. Thank you.
On Zoom, please press star 9 on your phone or the raise your hand icon on your screen. No comments.
Okay. So the question was weekly, every meeting or once a month. So,
Madam Chair?
yes.
Go ahead, we'll do it every meeting. To me, it's not a time issue. It's just, there's just a lot of these are just very minor things that we're not really giving you that much information. So I'm not sure what you're waiting for with bated breath. But yeah, every meeting's perfectly fine for me.
Yeah, I'm fine with that. I mean,
All right.
and if that helps get more information out to the public, that's good. And, the 5 minutes that I'm gonna lose, I won't be able to do, and not work at, I'm okay with. Trust me, we are working full-time, okay? Thank you.
More than that sometimes, yes. Okay, so Supervisor Hernandez, are you okay with every meeting to present an update?
Sure. I mean, at the end of the day, you're gonna have less meetings in between, obviously, so you have less to report. I mean, to me, the main thing is just being objective and to the point, and because I know we could easily elaborate a lot, and all of a sudden it's 12 o'clock and we haven't really gotten very far. So thank you, Madam Chair.
And as to the public comment regarding the tax sharing agreement, I don't even know the details of that yet, so I'm in the dark too. I'm not on the committee for that, and so I'm waiting with bated breath on what the details of that is also. So, yeah. All right, so 12:16, then
Yep.
can we go ahead and go to the working lunch? So let's announce closed session. And then
24.
How much time are we looking at before we do that?
Probably at least an hour and 15 minutes, probably.
An hour and 15?
Yeah.
Okay. So that would take us until 1:45-ish. Okay, so,
1:30. 1:30.
oh, we're an hour and 15, I'm sorry. I thought an hour and a half. Okay, 1:30. All right, so go ahead, Barbara.
24, conference with labor negotiators, agency designated representatives, Danya Torres Wong, Michael McDougall, Ray Espinoza, Edgar Nolasco, Gabriel Orozco, Barbara Thompson, Elvia Borosio, employee organizations, institutions, association, law enforcement, management employees group, SEIU Local 521, Deputy Sheriff's Association, confidential management, appointed department heads and unrepresented employees, and SEIU Local 2015. Under Government Code Section 54957.6 and 25 is conference with legal counsel regarding pending litigation, Government Code Section 54956.9A, Western Resources Legal Center versus County of San Benito Superior Court, CU 21-00204. Any public comment?
If you'd like to make a comment in chambers, please provide a speaker card on Zoom, press star 9 on your phone, or the raise your hand icon on your screen. No comments.
Okay. So we'll go ahead and adjourn for lunch, working lunch, and resume back at 1:30. for closed session?
No reportable action.
Okay. So then let's move on to the consent item. Items number 6 through 23. Let's go ahead and go to public comment, and then we'll pull items from the consent item per supervisor's request.
If you'd like to make a comment in chambers, please provide a speaker card. On Zoom, please press star 9 on your phone or the raise your hand icon on your screen. Elia Salinas.
Thank you, Madam Chair. It actually would be more beneficial to the public if you allowed the supervisors, the board, to name which items they're going to pull. Therefore, the public comments don't have to be as long, and/or can actually focus on those items that the supervisors are going to pull. Because honestly, I want to pull, or I want to talk about item 10 only in anticipation that I believe a supervisor may be pulling it. I don't know that. And if you allowed the board to mention which items are going to pull, I would not have to stand up here and say that I want to pull item 10. That being said, item 6, 7, 11, 15, no, I'm sorry, 16 and 17. I just want to point out, make a comment again on items 6 and 7 with regards to the dates that these contracts are coming before the board. They should have been done well before the July deadline, and now you're in October wanting to go back. I don't know what the auditing process is at the department, but obviously there's an issue if you're having to file something 3 months later to try to update a contract that's already expired, and you're now making it retroactive. This is not the first time. This continually happens, and something needs to be done about that. I want to congratulate County Counsel Barbara Thompson for the contract to continue as County Counsel. I think she does a great job. She does a great benefit to San Benito County, and you should all be very proud of the work that she does for you. And obviously, by approving the contract, you're showing her that. Item 16, what is the agreement? You're adopting a resolution, and when I highlight the light item, it just states again that if you're approving a resolution and I would have to go to the packet, the public would have to go to the packet, and the packets can be hundreds and hundreds of pages and they're difficult to find. I would suggest again that you add more language to this so that the public, for transparency, knows exactly what it is that you're approving here. Item 17. Was there a public notice, or is there going to be a public notice for others to participate in such an agreement to allow other food concessions out at the Veterans Park? And if there's going to be, because now it's a non-exclusive, it states here, but if now you get a swarm of people coming up and wanting to open up and have their own catering trucks out there, what is the limit going to be? And is there a business fee or an agreement of some of those revenues other than tax? And again, I have problems with these catering trucks that are out in the county that are not doing it correctly. This company is coming forward and doing it correctly and asking for permission. But again, the ones out in the county are taking in revenue, and we're not getting any revenue out of it. So that being said, is there you're granting permission. So this is on a cash basis. How do we keep track of what the money is being out there so that it is beneficial towards the county? and/or towards the money's going to upkeep Veterans Park. Thank you.
On Zoom, if you'd like to make a comment, press star 9 on your phone or the raise your hand icon on your screen. You've been unmuted. Please state your name and how many items.
Item 11. 2 weeks ago in closed sessions, you reviewed and considered a new term for county council's contract. I can only assume you've reached new terms as that contract has been placed on today's consent agenda. That placement means virtually an automatic approval amid a list of things that the board will not individually discuss. I'm concerned by this as I think all county residents should be. Here's why. County council is among the highest paid county worker, about $180,000 in 2018, according to public records. So a new 4-year term added to her existing contract will likely cost the county more than $750,000. That is a big commitment and expenditure of public funds. I'm not suggesting the final outcome, but in the end, council works for the people in public position, paid for by the people. Should all of this discussion about her performance and employment be hidden from public view? County council is also one of the most senior advisors on the board. In simple terms, it's a job. It is ensure the county's operations are done within the law and to protect the county and to defend it from legal actions. Very important stuff. But in the past year or so, the county has lost 3 significant lawsuits because of the behavior on legal matters, and it has paid tens of thousands of dollars in legal settlements from public coffers as a result. That's important too. This all seems worthy of more consideration than a virtually automatic consent calendar approval. After all, a closed-door discussion, which is what staff is recommending, this decision will impact county operations for at least 4 years, and likely more given the ongoing litigation the county has been exposed to due to county council's recent missteps. The people should be allowed to know what is being done on their behalf. I would also suggest that the board wait until the
Okay. So what is the will of the board with regards to items number 6 through 23?
Madam Chair, I'd like to pull 6, 7, 11, and 13.
6, 7, 11, and 13. Supervisor Tiffany?
I was going to pull item 11, but I have nothing else to add.
Okay. Supervisor Hernandez?
I believe you're muted.
Sorry. Yeah, I was muted. Sorry. I said nothing to pull, Madam Chair.
Nothing to pull, is that what you said? Yeah, okay. Neither do I. So we have items number 6, 7, 10, 11, and 13.
Not 10. 6, 7, 11, and 13.
I thought Colin had asked for 10. No, I thought,
No.
no? Okay, I'm sorry.
Mm-mm.
Okay, so 6, 7, 11, and 13.
Yeah.
Okay, so then can I get a motion by the board to pull all other items other than 6, 7, 11, and 13?
I'll make that motion.
Okay.
Second.
Okay. All in favor?
Aye.
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 Okay, so you have a 4-0 on those items. So let's go ahead and start with number 6 first.
Yes, and this is Alan from Behavioral Health. Can you hear me?
Yes.
Okay.
Yes.
Yeah, so I pulled this, I have the same issues as you can guess that I've had in the past with these contracts. So I don't really necessarily expect any different explanation, but if there is something, unique to these two, 6, and I don't know if we want to group, I guess we can take 6 first. But I have the same issue with 6 and 7, just the lack of going out and, examining if there are other options here.
Madam Chair,
Yeah, I think.
if I may,
Go ahead.
can we hear both those items at the same time then, if that's the same issue? Okay, thank you. Go ahead, Alan.
Yeah. So, contract number 6, Traditions Behavioral Health. That contract is very unique because Traditions Behavioral Health is a company that is not like any of the other temporary staffing companies that we utilize. So they're the only business that I'm aware of that can do a long-term placement. And that essentially is actually the biggest selling point about Traditions Behavioral Health is you don't have to incur a lot of upheaval with the switching to different providers as they rotate out placements. So this particular psychiatrist has been with us for many years, and we're very thankful of that. And I think that's the uniqueness of Traditions Behavioral Health. I'm not aware of any other company. In fact, I don't believe any other company can offer that to us. So that's what makes this contract so very different than our other temporary staffing agency contracts. And everybody has been very happy with Dr. Wong. And I think the clients appreciate tremendously that we don't have upheaval and turnover in our psychiatrist providers. They can build a relationship with that person over time. They can count on seeing the same person over time for their appointments. So I think that the longevity of Traditions Behavioral Health is, in fact, the biggest selling point about Traditions and makes it very different than the other agencies.
And so there, I mean, you said you're not, it doesn't sound like you were necessarily resolute. I mean, did you guys do any searching? Was there even ever any effort initiated, or are you basically just bringing this back? There's 10 prior contracts on this. There's 10 prior contracts, no amendments on number 7. You know, I'm a believer that at some point we need to look at a policy of every X number of years. You need to come back and do an examination of whether we're getting the best. I can't just trust you by your word here. And it doesn't sound like the department did any effort at all, again, to even remotely look into this or to even acknowledge that there are concerns on the board. So I'm just continually frustrated, and I'll be opposing 6 and 7. Thank you.
If I may do some explanation on 7 also. 7 is a Merced County Department of Mental Health produced contract. We did not produce the contract, and they wanted to go back even further. They have been historically tardy in production of their contracts, and we told them that we couldn't do that because the previous fiscal year had already closed. So they were doing their best just to get us the fiscal year 21-22 contract. And because it came so late, we suggested it be a 2-year contract. And this contract is primarily to access Merced County Behavioral Health's inpatient unit. And we need all the inpatient providers that we can get. Otherwise, people spend more time in the emergency room as we look for beds for them in psychiatric hospitals that don't have a lot of availability, which is a problem throughout the state. So that's the story on the Merced County contract number 7.
That was all.
Any other questions or concerns from the other board members for item number 6 and 7?
Yeah, Madam Chair, I guess my only comment would be, while I totally understand and I tend to agree with Supervisor Kosmicki on these contracts that keep coming back to us like this without, going through a proper process. I guess my greater concern is I worry about, given where we are, the loss of potential services we may run into. So I don't disagree with Supervisor Kosmicki, but I'm going to support them. But it's clear we have to address this issue. And I know, Ray, this has been already a discussion, a major discussion item. Thank you.
Madam Chair, if I may comment on this. So I've had multiple meetings with Alan and his team concerning contracts, and I just want to make sure that the board is clear that the Behavioral Health Department will be coming back and presenting all of the contracts. I've asked for it to be in the spreadsheet and to outline what contracts are state contracts, what contracts are in essence really contracts that other counties or jurisdictions are requesting of us, as well as just standard contracts. And then also too, requesting them to go out to RFP and put a plan together, because going out to RFP with all of their contracts is going to be a pretty big pill to swallow for 1 year. So I want them to put a plan together over multiple years to get that done. So they are working on it. Ellen is well aware of it. And I've asked him that has to come at some time within this end of the next few meetings that we have before any other contracts come back to your board. So then that way you guys are aware, the board is aware of where they stand with all of their contracts. Just an FYI on that.
Supervisor Hernandez?
Yes, thank you, Madam Chair. I'll just keep it brief. Although it makes sense what our CAO mentioned, just even for our education and understanding. I know talking to Alan and talking to Ray, at the end of the day, a lot of these are specialty services. You're not going to find them in-house. So, from a business practice, if you think about it, if you're going to go keep looking for other contracts, you're going to spend a lot of time and money just on that effort. If you already know that you understand the industry, you know who provides the services, why would you go do a bunch of extra steps when you know that, as Alan mentioned, this is a limited, there's no one else that can provide those services in number 6 or well enough. So bottom line is really, to me, it's having a good relationship with Alan and making sure that, yes, we do understand the implications of these contracts, but to micromanage them, I don't think serves the purpose of behavioral health as well as we think it does. I mean, we can try to tell him what to do, but if he's already doing it, I don't think that encourages trust. I think that discourages trust. Those are my comments, Madam Chair.
And the only thing that I'll add is each time we look at the consent item, when I sit with our CAO and our county council, this comment comes up that we know that if it's a contract, if it didn't go out for RFP, then we know it's going to be pulled. We also know about individual specialized services. And so this is an ongoing conversation that we are having eternally. But Alan, what I would suggest is you just follow through with what Ray had suggested. I think you're going to get a lot more leeway and approval from the board as a whole if you give us that spreadsheet as to contracts so that you can show that you're doing your due diligence. I know from my experience of being on the behavioral board, when you're questioned and you give us an explanation, they're valid and I can understand that, but we keep having this conversation again and again. So I'm asking you that you just work with us so that way we just get a little bit further than where we are right now, okay?
Madam Chair, if I may add one more comment.
Yes.
I know that this comment's been brought up multiple times by the public as well as the board at times. And when you look at the dates, July 1st, a lot of times it's impossible because they're by the time they get it signed back from the state, there are 3 months. I've seen 18 months later that we've actually received the contract from the state or other agencies. So I wanted to present that and make sure that it was clear for the public as well as the board that a lot of these dates, especially in the behavioral health and health and human services contract world, we don't get the contracts timely. So just FYI on that.
Okay. So then on that note, what is the will of the board for items number 6 and 7?
I'll make a motion that we approve both contracts for item 6 and item 7.
Okay, and I will second that. Oops, did you want to second that, Supervisor Hernandez?
It's fine, Madam Chair.
You could let him have it. Okay, so we have a first and a second. So all in favor, item number 6 and 7?
Aye.
Aye. Those opposed?
Nay.
So we have 3-1. Supervisor Kosmicki as being the nay on that. Okay, so we'll go down to item number 11. So it looks like both Supervisor Kosmicki and Tiffany had mentioned this.
Well,
First, or you want me? Doesn't
I
matter.
don't care. Go ahead.
All right. Madam Chair, thank you.
Yes, go ahead.
So my biggest, I think what stands out the most about this, I've been clear about this is now an open session, obviously, but that I vehemently disagree with the arrangement of a guaranteed 4-year, what I would refer to as almost like an ironclad contract. It's nothing at all personal with Ms. Thompson. The state law is pretty clear about that when you initially hire somebody, that you, with this particular position, the county is required to appoint to a 4-year term. And then when you go beyond that, though, I see nothing that explicitly lays out a reappointment provision or multiple terms in the language. And we do have precedent, even in our own county, with prior county council. The late Matt Granger had served as county council without a 4-year agreement. And for whatever reason, the state legislature, has that. When you hire somebody, I guess there are reasons for that, but it essentially just gives somebody, it's not guaranteed literally, but in practicality it is. You can be let go for cause, but there are very narrow reasons that you're allowed to do that. So it really puts the county, to me, in a position that we're setting this position aside and saying that we're willing to give them more of like I said, an ironclad arrangement than really any other employee, including electeds who can be recalled. And so with this position, they're really they're protected to a large degree. So in the first 9 or 10 months, I don't want to. Again, I appreciate the county council. She works hard. I know she's dedicated to the county. She's accessible. There are other areas that I just think we need to work on, such as, just trying to stay away from policy advocacy. To me, the county council is a legal advisor, and that should be the sole focus of the job. And I've had issues where, and maybe it's just culture, we're a new board, but maybe it's just how it's been. I don't know, but I just haven't felt comfortable at all times with where I felt like the county council's office is pushing policy as opposed to advising. And then I also have issues, and I've talked to Barbara about this. She's well aware about, just long-term looking at, we really need to rein in these outside litigation costs. We can't have it both ways. We've got a staff that's a good staff of attorneys that are qualified. That's very expensive, and then we're going out and getting outside litigators. When I don't think it's always necessary. I think it is necessary for certain instances when there are very specialized reasons for it. But I would really like to see us clean that up, and I would like to see, even if it means a deputy county council is going and spending 2 weeks in a trial, I would rather do that than go hire somebody for the same amount that we're going to basically pay a lawyer for an entire year. It just doesn't, to me, fiscally does not make sense the way we've been doing things. So that's really, I just don't agree with the 4 years, and that's my biggest issue here. And otherwise, I think I explained the whole at will. So you can either be at will or you can be let go for cause, and everybody else is at will, and then we have somebody who's with cause, and these very, very narrow reasons why you can. And I'm not suggesting we let her go at all. I'm just saying that we need to protect the county. That's our job as a board, is to be responsible fiscally, and so that I'm not comfortable with that going forward, and then. I think that's it. I think going forward, though, I would like to suggest to the board that when we go through this again, that we're all new to the board. I think it would be really wise if we have outside representation for us on the board when we're dealing with, Barbara's an attorney, so she just has an advantage, basically. She came in, laid out all these things, laid out the 4-year term. I think there was some confusion on the 4-year term part. We need to have representation when we're negotiating with our county council, and I would say our CAO as well, that just really, from a management perspective, makes a lot of sense. Otherwise, we're essentially approving a 4-year, at this point, a 4-year, to what I see as a guaranteed contract, and I can't support that. Thank you.
Supervisor Tiffany?
Thank you, Madam Chair. The reason I was going to pull it is just because I knew this issue would come up, and also some comments made by the public. Well, first of all, I just want to make the comment that, and I think that Supervisor Kosmicki agrees with this, as well as all of us. We all feel that County Council, Barbara's has been doing a very good job. And I think we're not unhappy in any way with, the performance that she's doing. I think the question has to do with the term. I'm very comfortable with the 4-year term. I know, like many of us, we're new to the board, but I think that Barbara's been doing a very good job. I think there's a lot to be said for continuity. And so I think the additional 4 years is warranted. I know that one of the reasons why the argument for a 4-year term with county council is that it minimizes the possibility that there would be any conflict of interest or any political overtones if you were a year to year. And so it creates a county council to be a more independent voice. And I think that's the reason why it is the way it is. So anyway, I'm supportive of the 4-year term. I understand Supervisor Kuzmicki's points. I also want to just mention, although this was on the consent agenda, it is an item that all of us have talked about extensively. Of course, it's a personnel matter, so in closed sessions, there's been a lot of discussion and discussion directly with Barbara. So it's not as though this is something that was, we're just trying to slam through. So those are my comments. Thank you.
Supervisor Hernandez?
Thank you, Madam Chair. So to me, it's pretty simple. There needs to be checks and balances, but at the end of the day, you need consistency and continuity. You're not going to get that by having these year-to-years. And I don't agree with Supervisor Kuzmicki on somehow, I guess, this outside counsel sentiment. I mean, that's to me akin to agreeing with an autoimmune disease. Like the goal is to somehow overly scrutinize our own department head because, I mean, that's what our position's for. I mean, at the end of the day, I actually had a question for county council, just even on the definition, because ultimately it sounds like, which maybe with good intent, the questioning of a 4-year term, because it might be, Barbara might have too much power, and I guess maybe it's a little scary or something. But so the question, Barbara, that I was going to ask is, can you give me a little bit more clarity on what it defines neglect of duty, malfeasance, or misconduct? Can those be, to a certain extent, subjectively interpreted by the Board of Supervisors?
Madam Chair, if I may respond, Barbara's asked that I respond to any questions with respect to this matter, because obviously she's personally interested in it. The answer to that question is it depends on the facts. So if you have specific facts that, in your opinion, constitute misconduct, then you can initiate the proceedings to remove the county council from office. So it would depend on specific facts. The case, one of the cases that we cited, Guarino, involved just that factual situation where there were allegations made about the behavior of the county council that was investigated, I think, 3 times, and ultimately the board decided to proceed with proceedings to remove him, and then he resigned. So in that case, it sounded like it was workplace discrimination, the exact nature of which is not clear from the case. But it is not, first of all, under state law, and this is not a contract, this is the county council is a county official. And under state law, the county official's term of office as county council for a general law county is 4 years, and subject to being removed either through grand jury proceedings or through proceedings initiated by the board, through the board for cause. And so this only applies to general law counties, of which San Benito is one. So it's not an option for the board. If you're appointing a county council, each appointment is a term of 4 years.
But and Joel, thank you for the answer, but you kind of didn't answer it. But if anything, I still kind of got the assumption that yes, there's a level of subjectivity. So it's not ironclad the way Supervisor Kosmicki is mentioning. Neglect of duty, maybe I could use a specific example. If there were situations that were brought up of concern about a possible lawsuit and that wasn't addressed, I mean, would that be considered neglect of duty?
Pattern that would qualify.
Yeah, so there's subjectivity in it. I mean, at the end of the day, my big focus is making sure that we have continuity with this position, and to a certain extent, I like that there's a level of separation between her and the board. I think that's fair, right? Because if we have outside counsel, then there's kind of scrutinizing of that, which kind of pushes them in the direction of becoming very leaning into maybe a board majority, and I don't think that's healthy. She has to, whoever the county council would be, I think would have to have a level of objectivity and not have that intimidation element in why she would answer to certain issues or legal matters. Thank you, Madam Chair.
I just want to add that I disagree with the public comment. The gentleman who called in, I believe I recognize his voice, but I won't identify him, and I totally disagree with him. I fully support County Council and Barbara Thompson in all of her efforts that she has done in representing the county. I fully understand the statutory requirement for a 4-year appointment, contrary to one of my fellow board members, what they believe and what they think. But I kind of resent this conversation about malfeasance and any of that, because then it sounds like we're attributing something of that nature to Barbara Thompson, and we have not had any conversation to that effect at all. And so right now, this is just merely to affirm the appointment of a 4-year. It is a statutory term. It's a term that we can't go less than. So whether one particular person doesn't like the 4 years or not, it is the law. And we have appointed it. And so now we are just here to affirm the position that the board has already made. But as I said, just to clarify, there are no allegations of any kind of malpractice, negligence, malfeasance of any of that nature attributed to Barbara Thompson. So on that note,
can I make one quick follow-up?
Actually, no, because
we're not going to do. We're never going to allow follow-ups. I just would like to point out that Barbara Thompson herself noted that we could have her on board without a 4-year term. Just to be clear.
No, what we're talking about Barbara Thompson has a contract of employment with the County of San Benito from 2017, and what she was saying is that she doesn't want to. That contract does not have a term, an end term to it. It applies while she is serving as county council, and so she's not requesting a contract. What is on the agenda today is appointment to a 4-year term of office. That's different from a contract.
No, I'm just saying she pointed out that she could follow the same model that Matt Granger had followed previously, which was not a 4-year term. That was explicitly stated. So
I have no idea. I have no idea what Matt Granger's arrangement
I just want to point that out for the
was.
record. Thank you. And I do think we need to allow follow-ups, Madam Chair. We're getting to a point where if you disagree with something I'm going to say, you're going to shut me off. You allowed Peter Hernandez to do about 5 or 6 follow-ups earlier. Thank you.
So with that in mind, can I get a motion for item number 11?
Madam Chair, I'll make a motion that we appoint Barbara Thompson to a new 4-year term as county council effective December 31st, 2021.
Okay, I'll go ahead and second that.
Second.
Okay, I'll give it to Peter. We have a first and a second. All in favor, say aye.
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 Those opposed?
Nay.
So we have a 3-1. let's go ahead and go over to item number 13. And Nora, I did see you walk in. Hello.
Good afternoon, Board.
Ooh, I'm glad that's done.
Appreciate that. I'm vertically challenged as I am. Okay. All right. So you pulled the item. So do you have some questions for me? or
Oh,
would you
yeah,
like
no,
me
I
to-
just pulled this I think it's a big deal. I just want to make sure that, that I bring to light.
It is a big deal.
Yeah, and so I strongly support a new library or expansion, and so we're going out for this grant, potentially $10 million, and we have to match it, and I think hopefully we'll find a way to do that. I know I'm going to get behind that, but I also want to just bring to light along with this that it kind of underscores to me that the need for a contracted grant writer. I know that's something we've talked about in the past. We're going out for a grant here. We're doing some other grant pursuits out there, but if we can get this grant, I'd be very excited about that, and that's all I just wanted to say.
Thank you, Supervisor Kosmicki. I have to say that I can't take full credit for this. I had been watching it and see when it would pass, and it finally did. But I have to acknowledge Mike Chambliss and Karen Gumman, our CAO, Barbara Thompson, because we all pulled together, and also Gabe in getting all the information and all the things that we needed, and so that we will be able, there's a few little things still that need to be done, and now with your approval and everything, we'll just get it finished and it'll go in on time. So it was a real team effort across the variety of departments, and I really, really appreciate it. I know that the Friends appreciate it, because if we do this, it will change a lot of things for us by having the space. We'll be able to be responsive to the needs of the community as opposed to being held back because it's a space that's dictating to us. And that prevents us at times from meeting the needs of our community. So thank you for your comments, Supervisor Kosmicki, and the support of all the rest of the board.
Thank you. Any other questions from the other supervisors? Okay, if there are none, then what is the will of the board on item number 13?
Move to approve as recommended.
Okay, can I get a second?
I'll second.
Okay, so I have a first and a
Second.
Okay, Supervisor Tiffany took that second. So I have a first and a second. All in favor? Say aye.
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 I have a 4-0 on item number 13. All right. So that takes us then to future agenda items. And I believe I heard Supervisor Tiffany and Kosmicki make an agreement on something that we had, but I didn't note it down. So what was that, the future agenda item?
Madam Chair, what it had to do with is bringing back to our next meeting the issue of COVID incentives.
Okay.
Because we'll be close to potentially running out, and I'd like to see us discuss whether we want to extend them in some manner.
Okay. So that was both Supervisor Tiffany and Kosmicki for that one, the COVID incentives. Any others?
Madam Chair?
Yes.
I received a request from Valerie Eglin to bring forward a proclamation recognizing former Supervisor Richard Place for his work in the late 90s to develop the Dianza Trail concept. The trail's become a really significant recreational resource here. Richard's now retired, and I know Richard real well. He's been contributed to this community for quite a long time, and I want to support Valerie's urging for a proclamation or certificate of recognition crediting the former supervisor for his work on this.
Do I have a second person who would support that?
I'll support it.
Okay. Supervisor Hernandez, did you have anything?
I had two items, Madam Chair, and I think it's already coming back, but just to make sure. One is the charter process. I know we were supposed to be educated on what that means and, how that could make a difference with even the funding issues we've had as a county. And then the other element, which I believe you agreed you would support, Madam Chair, is a clarification on the exemption process for COVID.
So today's presentation, was it enough for you, Supervisor Hernandez?
Well, we didn't get what that process was. I pulled the applications. There's a lot of ambiguity. There's a lot of questions surrounding that ambiguity. Yeah, I'd appreciate a lot more clarification.
We have a brief presentation, including a flow chart that we were going to present at the next meeting.
Okay. And then you also have something prepared on the charter, those two items?
Yeah,
right?
the charter
Okay.
was, the plan is to bring that back when we get a new supervisor, so fingers crossed we get one this month. But we're scheduling a presentation at the December meeting, so that's when we're gonna
Okay.
have
Yeah, I
it.
jotted that down this morning when you had mentioned the future items.
Yeah.
The Charter County, yes.
I was,
And that'll.
Madam Chair.
Oh, I'm sorry, go ahead.
Go ahead, Supervisor Hernandez.
I was just gonna, yeah, I mean, is there a chance that we can get an update on who our new supervisor is gonna be? Because I heard it was gonna be before the end of the month.
Well, we all heard the same thing you heard, 2 weeks, and we're in that 2-week window today, but I haven't heard anything.
We still have not received any word from the legislature.
The last thing I heard was early this week.
Yeah.
Well,
Yeah,
Tuesday is early in the week, so.
Tomorrow will be midweek.
Maybe before the end of the day, let's hope so.
Okay. So we have those 4 items then. Okay. All right, then, if there's nothing further, then can I get a motion to adjourn?
So moved.
Okay.
Second.
Second, first and a second, all in favor?
Aye.
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 4-0. Supervisor Hernandez, before you go any further, was that a yes on the tourism after today's meeting?
Yes, Madam Chair.
Okay, so then I will see you in a bit. Okay. Meeting adjourned.
Sounds good. Thank you.
I don't think so. We just double checked.